Hi everyone, very good evening to all of you guys. Myself, Dr. Vaibhav Jain, and today in today's class we are going to start the subject of psychiatry. Okay, we will be completing the all the important questions that has been asked till now. We will be doing everything. Okay, so please give me a quick confirmation so that we can proceed with the session, guys. Is everything all right? I know exam is really near now, and you guys must be anxious, but remember, guys, when you want to give up, remember why you have started. Okay, so this is the quote for the day. Don't give up. Okay, you should not give up. This is the last phase of your preparation. Give your best, and you will be on the other side of the fence very soon. Okay, so with this thing in mind, we will be starting our session. Okay, we will be starting our session with this thing in mind. We will be having all the important questions. Along with that, I would be teaching you how to solve the question. Along with that, I would be giving you the most important clinical question that you really need to know just before your examination. Okay, so feel free about anything else and just focus on the session, guys. Okay, very good. AK Sai Kumar. Yes, we can proceed now. So, the question number one, a 28-year-old male patient presented to the OPD. Okay, एक बंदा OPD में आ रहा है with the symptoms of when the clinician asked him where do you work? The doctor is asking him, where do you work? What the patient is replying? The patient is replying that India is a beautiful country. Modi ji is the prime minister, and I have a really beautiful girlfriend. Okay, and we work together. What kind of formal disorder this patient will be had? This is what kind of disorder, guys? Patient बोल रहे doctor is asking where do you work? The patient is replying all the things. Okay, patient is replying all the things apart from the answer. Okay, so it is a tangentiality, circumstantiality, incoherence, or loosening of association, guys. So they are basically formal thought disorders. Okay, so let me teach you the thought disorders. There are multiple questions from this particular thing. Okay, so I would be telling you the thought disorders. Okay, क्या पढ़ेंगे हम लोग? Thought disorders. What are the different kind of thought disorders we are having? Let's see one by one. The most important. Look one by one. We are having first one, that is flow of thought. First one is flow of thought or stream of thought. Stream of thought. So in your mind, for example, in your mind there are constantly multiple thoughts are coming in. Okay, so that would be leading to increase. If there is an increase in speed of thought, what will happen? Try to answer, guys. If there is increased speed of thought, okay, that we call it flight of ideas will be there. Flight of ideas. And what will happen? It is a feature of which disease? Okay, there are constantly multiple thoughts are coming in your mind. This is a feature of which disease? Try to answer. Yes, this is correlated with mania, guys. Mania. Opposite will be decrease speed of thought. Speed of thought, or you can say inhibition. Inhibition is a feature of which disease? Inhibition is a feature of which disease? What we can correlate? For example, I am telling you, for example, let me say multiple things. Okay, for example, my name is Dr. Vaibhav Jain. I am teaching you psychiatry. Okay, and we are having an interactive session. This is a fast speed. Okay, on the same page, if I am telling you my name is and I forgot, that would be decreased in speed of thought. Okay, for example, my name is, I will be teaching psychiatry. So that is the decrease in thought of speed. Okay, so there will be decrease in the speed of thought, and that is a feature of depression, guys. That is a feature of depression. Okay, so in flow of thought we will be having stream of thought, and two things will be there. Apart from that, second disorder that we are having is the important one, two times question asked from last exam, that is the content of thought. Okay, content of thought. What is the content of thought? For example, we are having delusions. So can anyone tell me what is delusion and what is the most common type of delusion we are having? So delusion is basically a firm and fixed belief. Okay, a firm and fixed belief which is unshakable. Okay, you cannot change. For example, I am saying that I am the God. Okay, so that is a firm and fixed belief. Nobody is going to change that. Okay, if someone will come and give me evidence also, then also I will not believe them. Okay, so that is the delusion. That is the delusion. And the most common type of delusion is delusion of persecution. Delusion of persecution क्या मतलब होता है बच्चों इसका? Delusion of persecution का मतलब wherever you are try to speak. Okay, so the meaning of delusion of persecution will be somebody wants to harm me. Okay, for example, let me give you an example. मैं बोलता हूँ my neighbors are conspiring something against me. They always want to kill me. Okay, they want to harm me. Just like that, we are having delusion of persecution. The patient will always have the feeling, उस बंदे को हमेशा फीलिंग आएगी कोई ना कोई उसे मारना चाहता है, कोई ना कोई उससे बदला लेना चाहता है, राइट? सो दैट इज द डिल्यूजन ऑफ परसिक्यूशन एंड इट इज अ कांस्टेंट फीचर यू विल बी फाइंडिंग इन अ डिजीज दैट इज नॉन एज schizophrenia. That is known as schizophrenia. Yeah, someone is after me. Very good. Okay, next we are having is form disorders, formal disorders, or basically they are the organization disorder. That means the organization of the thought is disturbed. Okay, that means what is happening, the organization of the thought is disturbed. First one, we are having derailment. Sir, what is the meaning of derailment? Derailment का मतलब क्या होगा? There is break in between two thoughts. For example, let me say myself, Dr. Vaibhav Jain, and I am teaching psychiatry. If there is any break in these two thoughts, okay. For example, let me say one more thing. Myself, Dr. Vaibhav Jain, I am teaching psychiatry, and कपड़े सूख गए हैं. So that is a derailment. What is happening? Third thought is not related with first and second. Okay, so that is your derailment. Okay, next thing. Next is your loosening of association. Loosening of association, we will be finding when a single thought is having two different component. Okay, for example, myself, Dr. Vaibhav Jain, and India has won the World Cup. This is the example of loosening of association. That means it is a single thought because and is there, but there are two components. Okay, and they are not related. That is known as loosening of association. Okay, next we are having is incoherence. What is the meaning of incoherence, Bacho? Try to speak. Incoherence, we can also call it word salad. Okay, so the patient will be telling I, me, yahan, wahan, upar, niche. He will be telling multiple things. Okay, so they are like word salad. Okay, they are word salad. Next we are having is tangentiality. What is tangentiality? In mathematics, remember we used to study about tangents. Okay, so what is happening? For example, the thought will not reach its answer. Okay, if someone is asking you something, he will never reach the answer. He will be telling all the things all around, right? So that is tangentiality. Last, we are having neologism. What is the meaning of neologism? Neologism का मतलब क्या होता है? Coining a new term, and it is a very characteristic feature you will be finding in schizophrenia. Neologism. Okay, we are also having circumstantiality. Circumstantiality means the answer will be attained, but after multiple thoughts. Okay, after multiple thoughts we will be having the answer, right? Next we are having is possession of thought. Okay, in possession we are having first one, that is thought insertion. For example, the patient will say, for example, I will say someone from like my neighbor is trying to insert some information in my mind, okay, via some kind of technology. So that is your thought insertion. Okay, second is your thought withdrawal. Thought withdrawal means what? For example, my neighbors can hear what I am thinking. So that is a type of thought withdrawal. That means they will be getting whatever I am thinking. They are understanding that. Okay, they are taking my thoughts away. That is known as thought withdrawal. Third one is your thought broadcast. इसमें क्या होगा? The whatever things I am thinking, जो भी मैं सोच रहा हूँ, it is coming loud. Okay, it is coming loud, and the people who are near me are able to hear this. Okay, so thought broadcast is the third thing. Okay, okay, so these are the thought disorders. Okay, disorders. Now try to answer the question. Now you already know what we have discussed. So first thing, is there any connection between these things? No, there is no connection. And did you get the exact answer that you want? where do you work? He has not replied where he is working, right? So what would be your answer, guys? What would be your answer here? Is it loosening of association, circumstantiality, or tangentiality? Is it loosening of association, circumstantiality, or tangentiality? Look here, if this was the question and we are getting an answer after we are getting an answer, that is your circumstantiality. मतलब क्या हुआ, घुमा फिरा के आंसर दे दिया. बट if A is the answer, we are not reaching at the point B, that is your tangentiality. Tangentiality मतलब आंसर नहीं मिला. If you are getting answer after a lot of thoughts, that is your circumstantiality. Here, very good guys, the answer will be tangentiality, because he is not answering. He is not answering at the end. He is not answering where he is working. He has told everything that is knows he knows, but he is not answering, right? So this is the question number 1. Okay, now move on to question number 2. A 39-year-old female arrives at emergency department. एक lady emergency department में आती है with the police, and she is accusing that all her neighbors are conspiring against her. Okay, and they want to kill her. After police investigation, police has confirmed that there is nothing like this. Okay, it is a false accusation. And what kind of disorder will explain this? Try to answer this one. So there is a lady who is having some kind of belief. Just a moment, guys. So there is a lady who is having some kind of belief that people are trying to kill her. People are trying to conspire against her. Okay, so what is this case? Try to answer. What is this case, guys? What is this case? Loosening of association. Okay, loosening of association means there is breakage between a single thought. Okay, एक ही thought के अंदर क्या होगा? There is no association. For example, myself, Dr. Vaibhav Jain, and India won the World Cup. Okay, this is a loosening of association, first thing. And tangentiality means what? You will never get the answer. If I ask, tangentiality means what? You will never get the answer. If someone will ask me what is my name, I will tell I live in Jaipur, I am teaching psychiatry, all those things that I know I will tell, but I will not tell the patient, I will not tell the clinician that my name is Vaibhav. That is the tangentiality. Clear? Okay, so try to solve this one. So you are saying A, Diksha, Neha, delusion of persecution. Okay, so basically what is delusion? Let me teach you what is delusion. So delusion is a firm, fixed belief which is unshakable. So this is a delusion. Now our patient is having a belief that her neighbors are conspiring against her. Okay, so first thing is clear. That means the patient is having some kind of beliefs. Patient is having some kind of delusion. That is clear. Okay, what is second option? What is superstition? What is superstition, guys? What is superstition? Delusion you have already answered. That is A. Your answer is also right. That is A. Okay, but what is superstition, guys? When delusion is shared among a lot of people. When a delusion is shared along a lot of people, that is known as superstition. Okay, for example, I am having a delusion that I am God. That is known as delusion of grandiosity. मुझे लगता है मैं भगवान हूँ, लेकिन मेरे आसपास वालों को भी अगर ये लगता है, people around me also feel that I am God, so that is a superstition. Superstition means it is shared among the society. There is a false, firm, fixed belief that I am having, that is delusion. If this delusion is shared among people, multiple people are thinking like that, yes, he is the God. So that is known as superstition. That is known as superstition. Okay? We are having multiple delusion. What is delusion of reference, guys? Try to answer. What is delusion of reference? Delusion of reference. What is delusion of grandiosity? These are all one liners you need to remember. Okay, we are having nihilistic delusion. Nihilistic delusion. We are having nihilistic delusion. So delusion of reference is whenever there is delusion of reference, that patient will feel, the person will feel everything is happening about me itself. Okay, जो भी दो लोग अगर बात कर रहे हैं, he will think that मेरे बारे में बात कर रहे हैं. दो लोग अगर कुछ भी कर रहे हैं, so he will always refer himself. Okay, हमेशा वो खुद की बात करेगा, हमेशा वो खुद की बात करेगा. What is the meaning of delusion of grandiosity? Grandiosity means he will be thinking like I am the God, that is aham brahmasmi, right? So that is, he will be having delusion, that he will be having belief that he is the God, right? So that is your delusion of grandiosity. What is nihilistic delusion or delusion of negation? इसको लगेगा सब कुछ खत्म हो गया, right? Delusion of negation, he will feel like everything is gone. Okay, nothing is left. Okay, that is the delusion of negation, guys. Okay, what is hallucination and what is illusion? Try to answer. What is hallucination, what is illusion? Basically both of them are perception. Okay, both of them are perception. Perception का मतलब क्या होता है? Whatever I am perceiving. Okay, so ये दोनों क्या है? Perception है. Whatever I am perceiving with the my senses, right? For example, I am looking at things, whatever I am perceiving, that is perception. So perception can be illusion, perception can be hallucination. Try to answer what is illusion. What is the meaning of illusion, guys? Okay, illusion is basically a false perception of a real object. Okay, for example, this is a pencil, right? If I say this is an umbrella or this is a sword, what is this? This is a false perception of a real object. ये real object है, अगर इसका false perception है तो ये क्या हो जाएगा? Illusion हो जाएगा. Okay, in the same case, if I say what is hallucination? Hallucination will be false perception. Again, there will be false perception, but in absence of any object. In absence of any object, that means there is nothing. For example, I will say this is a sword. I can see it clearly. Okay, hallucinations are, remember guys, hallucinations are vivid as real. They will be looking real to the patient. जिसको दिख रहा होगा उसको बिल्कुल clear दिख रहा होगा. Okay, this is how you will identify. Plus it will be occurring in outer and objective space. Okay, it will be occurring in outer and objective space, यानी उसको बाहर कुछ ना कुछ दिख रहा होगा. Okay, so that is a hallucination. Okay, these are the positive symptoms. These are the positive symptoms of schizophrenia. Positive symptoms of schizophrenia. Okay, can anyone tell me what is the most common type of hallucination? What is the most common type of hallucination? Most common type of hallucination is, try to answer what is the most common type of hallucination. Yes, Nidhi, Diksha, Ishan, try to answer this. So the most common type of hallucination is auditory hallucination. Auditory hallucination. Okay, so try to answer here. So basically our patient is having some kind of delusional disorder. Okay, our patient is having some kind of delusional disorder. So in this case your answer will be A. In this case your answer will be A. Not visual, guys. The most common type of most common type of hallucination will be auditory, guys. Auditory. Okay, visual hallucination you will find in organic disorders. Okay, for example, the patient is having some kind of trauma. In those patients, visual hallucination will be more common. Okay, yes, hallucination में भूतों की आवाज is the auditory hallucination. Okay, अगर किसी को भूत दिख रहा है, that is the visual hallucination. Okay, and remember they will be looking, मतलब ऐसा नहीं होगा थोड़ा बहुत दिखा गायब हो गया. Okay, he will be clearly looking at those भूत, whatever thing you are seeing. Okay, वो बिल्कुल साफ साफ दिखेगा, vivid दिखेगा एकदम. Then only we call it hallucination. Okay, try to solve this one. A 27-year-old boy brought to the OPD by his family with the complaints of, what is the complaint? First one, he is having hallucination for last 2 months. Okay, इसका breakup हो गया. After a breakup with his girlfriend, the boy hear voices. इसको क्या सुनाई दे रही है? आवाजें talking about him and commenting on his actions. Okay, the boy also stated that he feels that someone is inserting these thoughts into his mind, okay, with some technology. What is the probable diagnosis in this case? Try to answer this one. First of all, what are the symptoms that we are having? First thing we are having, look here, the patient is hearing voices. Whenever we are having voices is regarding as a third person, right? Voices is regarding as a third person, so that would be giving us hint that is a auditory hallucination. Auditory hallucination, first thing. Second thing, we are having auditory hallucinations on which are commenting on his actions. Okay, so these are basically running commentary. Running commentary क्या हो रहा है? अभी वो पेशेंट उठ गया, ओके, अभी वो आगे जा रहा है, उन्होंने पानी की बोतल उठा लिया, वो पानी पी रहे हैं, सो ही इज हियरिंग दिस टाइप ऑफ वॉइसेस. These are known as running commentary. Okay, this is a auditory hallucination, running commentary present, and he is also having complaint that someone is inserting thoughts in his mind. Okay, so that is thought insertion. Thought insertion is also present. Okay, thought insertion is also present. So what do you think, guys? Is it schizophrenia? Is it schizophreniform disorder, brief psychotic disorder, acute psychotic disorder? Yes, everyone is answering A. Nidhi, Study Life, Dr. Ishan, sorry, all in one, Neha. So let me teach you what is schizophrenia. Schizophrenia will be having some symptoms. These are known as, the term schizophrenia was given by Eugene Bleuler, and he has given 4 symptoms. Okay, ये psychiatry दिया था इसने, psychiatry. Okay, he has given these 4 symptoms. These are your affect disturbances, autistic thinking, associative looseness, and there will be ambivalence. Okay, second, we are having SFRS symptoms. Kurt Snyder वाले जो है, these are your Snyderian first rank symptoms. Okay, these are your 11 SFRS symptoms we are having to identify schizophrenia. Okay, schizophrenia को identify करने के लिए we are having these 11 symptoms. Okay, these 3 are voices. Okay, these 3 are voices: audible thoughts, voices arguing, voices commenting. So basically they are talking about auditory hallucination. Second one, we are having thought with insertion, thought withdrawal, okay, and thought broadcast. They are collectively known as thought alienation. Okay, and then we are having mad impulse, mad affect, and mad violation. Okay, then we are having mad impulse, mad affect, and mad violation. Okay, and lastly we are having delusional perception. It is a common thing that you will find in schizophrenia. Okay, so based on this we will be identifying whether the patient is having schizophrenia or not. Okay, schizophrenia is a clinical diagnosis that we are making, and we are making it on the basis of multiple symptoms. Okay, बहुत सारे symptoms होंगे, they are always like one symptom is overlapping with the other symptoms. Okay, so we need to make diagnosis based on this. Okay, second thing, after making the diagnosis, what we need to know, look here guys, we are having schizophrenia and schizophreniform disorder. How we will differentiate? If on the basis of time period. Okay, if the disease is less than 1 month, if the disease is less than 1 month, we call it brief psychotic disorder or acute psychotic disorder. Basically they are same things. Okay, if disease is lasting from 1 to 6 months, we call it schizophreniform disorder. Okay, we directly do not call it schizophrenia, that would be your schizophreniform disorder. And ultimately if it is more than 6 months, if it is more than 6 months, multiple episodes are present, that would be considering as schizophrenia. Okay, so here your answer will be schizophreniform disorder, guys, because in the question they have given you how much is the time that they have given you, that would be last 2 months. Okay, so बच्चों आंसर क्या हो जाएगा यहाँ पर? Schizophreniform disorder. Clear guys? Is there any doubt with this? Okay, yes, so the answer will be schizophreniform disorder. Less than 1 month, acute or brief psychotic disorder. 1 to 6 months will be schizophreniform disorder, and more than that, that would be considered as schizophrenia. Okay, bachcho. Now, next question that we are having, A 29-year-old girl is presented to OPD with the complaints of regular washing of hands. Regular washing of her hands, although she knows that it is completely illogical. Usko bhi pata it is completely illogical, but still she is not able to control this type of behavior. Whenever she tries to control it, she had feeling of एंजाइटी. जब भी वो रोकने की कोशिश करेगी, what will happen? She will be having a feeling of anxiety, feeling of depressed mood, right? All of the following are relevant to this disease, but what is the exception over here? Try to answer. I'm waiting for your response. Try to answer. Till then, anyone, what is the diagnosis that you are making? What is the diagnosis over here? The diagnosis will be obsessive compulsive disorder. Obsessive compulsive disorder. The diagnosis will be OCD. Okay, and remember guys, OCD will be having two components. One is obsession, another one is compulsion. Okay, so we are having two components, that is one is obsession, another one is compulsion. Okay, what is obsession? Obsession is basically a constant irrational repetitive behavior. Okay, it is basically constant irrational repetitive thought which is coming into mind. For example, the patient is having OCD of contamination. The patient is having continuous thought of washing hands. She will be thinking, she will be having thought in her mind, she will be having thought, my hands are dirty, it will be having germs, okay, I need to wash my hand. So this is the obsession. Obsession is basically a constant irrational repetitive recurrent thought which is coming again and again in the mind. Okay, how it will be satisfied? It will be satisfied with the compulsion. The meaning of compulsion will be, it is the motor act. It is the motor act, bachcho. It is the motor act to overcome compulsion. So what is the motor act to overcome compulsion? That means when she is going to wash her hands, she will be having relief, right? She will be having relief. Okay, so this is the two components of the obsession and compulsion. Okay, so if she is not going to wash her hand, what will happen? She will be having anxiety. Although she already know that it is ego dystonic. It is basically ego dystonic. She knows that there is nothing in her hand. Okay, wahan kuch bhi nahi hai, but still she is getting the constant thought. Okay, can anyone tell me what is the most common OCD that we are having? Okay, so if I talk about most common OCD that we are having, that is the question they have asked you. What is the most common OCD, bachcho? So that is the obsession of contamination, that is the example, followed by compulsion of hand washing, So this is the most common type of OCD. Okay, if they ask you now, question from NEET exam, if they ask you most common obsession only, if they ask you most common obsession, then your answer will be the same. Okay, then your answer will be the same, that is the obsession of contamination. That would be obsession of contamination. But if they ask you what is the most common compulsion, if the question they ask you most common compulsion, then your answer will change. What would be your answer now? Try to answer, guys. What would be your answer if they ask you what is the most common compulsion? Remember guys, that is compulsion of checking. तो जो लोग बार बार गेट का ताला देखने जाते हैं, गाड़ी की चाबी, गाड़ी का ताला, खिड़की बंद है, गीजर बंद है, so all those are the compulsion of checking and they are the most common compulsion overall. Okay, most common OCD, if they ask you, your answer will be OCD, will be contamination followed by hand washing. Okay, most common obsession will be obsession of contamination, and most common compulsion will be compulsion of checking, right? Compulsion of checking. Okay, so here try to answer. Here what will happen, guys? Try to answer. And one more thing, let me discuss how you will treat these OCDs. You will be giving a therapy that is known as behavioral therapy. Along with that, you can also use exposure. Remember guys, this is important. Exposure and response prevention therapy. exposure and response prevention. This is the important thing. Okay, for example, we are having exposure and response prevention therapy, right? So these are the two important things. Okay, now try to answer this one. This is your ego syntonic or ego dystonic. First of all, what is the meaning of ego syntonic? Ego syntonic, for example, I am having some kind of personality disorder. Let's say I'm a narcissistic person. Okay, so I am comfortable with myself. That is my personality, and I'm liking it. So this is ego syntonic. But if I am having a OCD, I know it is basically ego dystonic. That means I already know that this is not the right thing that I am doing, but still I am having this. Okay, so that is the ego dystonic. OCDs are ego dystonic, यानी patient को भी ये पसंद नहीं हुआ. So it is a true statement. Okay. Second, is there any insight present? Insight का मतलब क्या होता है? What is insight, guys? Insight is basically awareness of illness. Awareness of illness. Okay, one thing I want you to remember, insight will be present in all your neurotic diseases. It will be lost in psychotic diseases. Neurotic diseases like your anxiety and OCD, the patient will be having insight. That means the patient will directly go to the doctor. He knows that he is having some kind of disease. Okay, psychotic will be like, for example, schizophrenia. These patients will not have insight. Okay, it may be present, but generally they are the people in which you will be having loss of insight. Okay, next thing is your judgment power is normal. What is judgment power and how do we assess that? Okay, we will ask the patient, अगर कमरे में आग लग गई तो what will happen, what you will do. So अगर वो बंदा बोलता है कि मैं आग में कूद जाऊंगा, that means the judgment power is not intact. Okay, अगर उसके पीछे टाइगर पड़ गया, what he will say, either you will fight with the tiger or you will run away. So if he is telling I will fight with the tiger, that means his judgment power is abnormal. Okay, so in OCD, what do you think? In OCD, judgment power is normal or abnormal? In OCD, judgment power is normal. That is a true statement. Okay, reality testing is absent. Okay, reality testing is absent. Is this the case? रियलिटी टेस्टिंग का मतलब क्या होता है? पेशेंट इज लिविंग इन द रियल वर्ल्ड और ही इज लिविंग इन द ड्रीम वर्ल्ड. ओके, कुछ लोग होते हैं जो ड्रीम वर्ल्ड में रहते हैं. ओके, सो हियर OCD पीपल विल बी having reality testing present. Okay, so that would be the answer. This one is the odd one out. Okay, reality testing उनके अंदर present होती है. That should be normal. Okay, they are the people who are not living in dream world. Everything is fine with them apart from this particular thing, that is the OCD के अलावा सब कुछ ठीक है उधर, और कोई इशू नहीं है. ठीक है, so that is how you will be identifying. Okay, treatment part we have already discussed. Okay, next one. A 26-year-old male patient is presented to OPD. He is the patient with pre-diagnosed schizophrenia. एक पेशेंट आता है जिसको पहले से क्या है, स्किजोफ्रीनिया है. नाउ ही इज कमिंग विद द कंप्लेंट दैट ही इज अफ्रेड टू सी अ ट्रक. उसको ट्रक से डर लगता है, एंड लुकिंग एट द ट्रक ही रन्स अवे एज ही थिंक्स दिस ट्रक विल हिट हिम हार्ड, राइट? सो दिस थिंग इज अफेक्टिंग हिज लाइफ. द कंडीशन इज बेस्ट डिस्क्राइब्ड एज, व्हाट इज दिस? Yes, Harry, please try to answer. What is this? बोलो बच्चे. What do you think? Is it a delusion of reference? Is it a delusion of persecution? Is it a specific phobia, or is it a PTSD? First of all, what is delusion? Delusion means what? Delusion we have already discussed. Delusion is firm fixed belief which is unshakable, and it should not be shared by the should not be explained by your socio-economic or cultural society background. Okay, so that is the delusion. First thing, C or D. This is how you are going to mark the answer in the exam. C or D, 50-50. If you don't know any answer, how you will answer? First of all, try to eliminate, guys. Try to eliminate. Okay, first thing, delusion of reference. What is delusion of reference? We have already discussed that people are talking about me, people are referring me. This patient will think that people are referring me. Okay. Second is delusion of persecution. Delusion of persecution is the most common type of delusion. Here the patient will feel that everyone is trying to kill me. Okay, my neighbor is trying to kill me. उसको बहुत तगड़ा belief होता है. Delusion is basically he is having that belief. We cannot shake it. Okay, अगर हम लोग बता भी देंगे तो भी वो नहीं मानेगा. So that is the delusion. Okay. Next thing, specific phobia. Specific phobia में क्या होगा? Whenever those people who are having like agoraphobia or multiple phobias are there, we will be discussing them in the subsequent questions. So what is specific phobia? If there is any kind of specific phobia, remember guys, the patient will be anxious, the patient will have sweating. Okay, patient will have palpitation. What is palpitation? Try to answer. Explain me what is palpitation. Okay, patient will be having anxiety. Okay, patient will be having anxiety. Even specific phobias are those phobias, even just looking at the picture, just looking at the picture of the thing, what will happen? The patient will have increase in heart rate, increase in respiratory rate. Okay, the patient will be having irrational extreme fear. Okay, just remember this term. The patient will be having irrational extreme fear. Extreme fear. So that is specific phobia. That is specific phobia. Okay, that is a specific phobia. Here the patient is having PTSD. What is PTSD? PTSD क्या होता है? In PTSD, post traumatic stress disorder. Okay, abnormal awareness of one's own heartbeat. That is basically contraction of cardiac muscles, right? That is abnormal contraction is known as palpitation, right? So what is PTSD? PTSD में क्या होगा? Here there must be some history should be present. Okay, I know the question do not have much of history, but history should be present. Okay, apart from that, there will be some kind of traumatic or stressful event. Traumatic or stressful event which has happened in the past, because this is a PYQ exact. Okay, so there will be some kind of traumatic or stressful event in the past leading to some kind of symptoms. Okay, remember guys, remember one thing in PTSD. Remember guys, in PTSD you will be finding intrusive symptoms. You will be having arousal symptoms. And you will also be having, और कौन से symptoms होंगे? Avoidance symptoms. Avoidance. Okay, intrusive symptom में क्या होगा? Whatever thing has happened. Okay, जो हुआ था उसको सब याद आ जाएगा, right? Whatever things has happened, suppose उसका ट्रक से कभी एक्सीडेंट हुआ था, so that would be your whatever has happened, उसको flashback आ जाएगा. He will be having some flashbacks. So that is the intrusive symptom. Okay, second is your arousal symptom. What is the meaning of arousal symptom? The patient will always be hyper vigilant. वो इधर उधर देखता रहेगा, कोई ट्रक तो नहीं आ रहा, कोई ट्रक तो नहीं आ रहा. Just because he had some kind of accident in the past, what is happening? He will be hyper vigilant. मतलब ये पेशेंट हमेशा डरा हुआ रहेगा. ओके, ही विल बी हैविंग ऑलवेज फियर ऑफ ट्रक. ओके, इसको ट्रक से डर लगता रहेगा हमेशा, राइट? नेक्स्ट थिंग, अवॉइडेंस सिम्टम. अवॉइडेंस मीन्स व्हाट? अगर इसको कहीं पर चार दोस्त घूमने जा रहे हैं गाड़ी के अंदर, तो ही विल बी अवॉइडिंग दो सिचुएशन बिकॉज इसके अंदर डर बैठा हुआ है. सो दैट इज ही विल बी ट्राइंग टू अवॉइड सच सिचुएशंस. ओके, ये ट्रैवलिंग को अवॉइड करेगा. सो दीज आर द सिम्टम्स यू विल बी फाइंडिंग इन द पेशेंट ऑफ PTSD. ओके, यू कैन आंसर इट PTSD. ओके, यस, दोज पीपल हु आर हैविंग सम काइंड ऑफ एक्सीडेंट, वो लोग अब क्या है, ड्राइव नहीं कर पाते. कुछ लोगों का बाइक चलाते हुए बहुत गंदा एक्सीडेंट हुआ, अभी वो लोग ड्राइव नहीं कर पाते. अगर किसी के साथ भी बाइक पे बैठे हैं, also they will be having some flashbacks. That is intrusive symptoms. Apart from that, he will be hyper vigilant. वो पीछे बैठे रहेंगे तो भी पूरा चारों तरफ देखते रहेंगे, कोई आके तो नहीं ठोक देगा, right? And generally they will be avoiding to travel. Okay, they will be avoiding to travel on that particular type of vehicle. Okay, so that is the PTSD, post traumatic stress disorder. Okay, now try to answer this one. A 23-year-old female patient is having sadness of mood. First thing, experiencing a reduced sense of enjoyment in activities that are प्रीवियसली प्लेजरेबल, उसको जो पहले अच्छा लगता था अभी वो अच्छा नहीं लग रहा, ठीक है. दिस इज हैपनिंग फ्रॉम लास्ट 1 month एंड हाउ वी विल एग्जामिन दिस पर्टिकुलर पेशेंट. ये पिछले 1 महीने से हो रहा है. द पेशेंट इज हैविंग, पहले जिसको जो अच्छा लगता था वो अभी अच्छा नहीं लग रहा, ठीक है. और सैडनेस ऑफ मूड, मूड भी अच्छा नहीं है. सो व्हाट इज द सिचुएशन दैट द पेशेंट इज हैविंग एंड हाउ यू विल आइडेंटिफाई. ओके, what is this basically? The patient is not enjoying the activities that are previously pleasurable. इसको क्या बोलते हैं पर्टिकुलर सिम्टम को? This is known as anhedonia. Anhedonia, this is known as anhedonia. जैसे पहले मूवी देखना पसंद था, क्रिकेट खेलना पसंद था, डेट पे जाना पसंद था, घूमना पसंद था, राइट. सो all those things, okay, all those things, all those things will be having anhedonia, right. अगर अभी नहीं पसंद, दैट इज anhedonia. Anhedonia कहाँ कहाँ मिलेगा एंड हाउ यू विल आइडेंटिफाई? वी कैन नॉट आइडेंटिफाई विद द सीटी स्कैन, ये तो होगा ही नहीं. एमआरआई कराओगे? नहीं. वी कैन डू एमएससी और एमएमएससी. ट्राई टू आंसर which one is the right answer here. Why you are talking about past history all in one. PTSD में post traumatic, after a trauma, so there will be some history of trauma. You will be finding some history of trauma. In this question there is no history, I know, but still just for the sake I am telling you, if there is any history present then the answer will be PTSD. Okay, here the answer can also be delusion of persecution. If he is thinking that but he should not be having that delusion of persecution, but he should be having that specific delusion. That means a particular thing should be coming to kill him, right. So that is how it is, right. Next, this one you want to have again. Okay, look here guys, we are having delusion of reference. That means people are referring me, so this cannot be the answer. Okay, second is delusion of persecution. It can be the answer, but the patient is having fear of truck. Only the patient is having fear of truck, so that is not going to explain. Patient will be having fear from the neighbors, from the people. Okay, specific phobia, it can be an answer over here if there is no history given. Okay, and PTSD, why I am telling the answer PTSD, I am telling that this question is should be having some kind of history. I know history is missing, but if there is some kind of history is there, then the answer will be PTSD. Okay, that is why I am telling you D. Okay, yes, you can mark option C. Okay, now what are the components of MAC? MAC is mental status examination. What is MAC? Mental status examination. Mental status examination, guys. Mental status examination, which is basically a type of clinical examination. Clinical examination of the patient. Okay, MMSE, mini mental examination, we are using for organic mental disorders, like for example dementia. Dementia means there is loss of memory. Okay, so the number should be out of 30 it should be more than 24. That is for the MMSE. Okay, MSc we will be checking multiple things. Okay, what are the things that we will be checking in MSc? We will be checking for general appearance and behavior. Okay, we will be checking for speed. Increase in speed will be telling us about the patient can have mania. Okay, decrease in speed will be telling us about the patient can have depression. Okay, patient can have depression. Okay, then we will be looking for mood and affect. बोलते मूड खराब है, it is a long term thing, right. Affect is a cross sectional thing, okay, long term thing and cross sectional thing. Then we are having thoughts. We have already seen 4 types of thought. Okay, then we are having perception. Perception will be having hallucination, perception will be having illusion, perception will also be having delusions. Okay, next we are having cognition. Okay, cognition is basically a higher mental functioning. Okay, higher mental functioning, we will be checking for attention, concentration. Okay, judgment, I have already told you what is judgment. We will ask the patient the question, we will give some situations to the patient, and then we will ask the patient. Okay, and insight में क्या होगा, the patient will be telling us about the disease, whether he's aware of the particular disease that the patient is having, or he is unaware. Okay, if he is aware, most likely the disease will be neurotic. If he is unaware, most likely the disease will be psychotic disease. Okay, awareness will be told by this. Awareness of disease. Okay, perception will be having hallucination and illusion. Okay, what is illusion? What is the most common question that they will ask you? Someone is mistaking the rope, or for example, this is charger. Someone is mistaking this charger as a snake. What is this? Is it hallucination? Is it delusion? Is it delusion, hallucination, or illusion? What is this? Try to answer. If someone is mistaking this cable as a snake, what is this? Try to answer this one. Okay, so basically we are talking about emotions. Okay, mood and affect is basically emotions. Okay, so yes, AK, is it all in one? Hallucination, why? Remember guys, what I've told you. What I have told you, if there is no object and I am perceiving that this is a snake, for example, there is nothing in my hand, I am perceiving that this is a for example, this is a stick. Okay, if I am perceiving this is a stick, that means nothing is there, but I can see the stick. That is hallucination. Okay, if I am having something, false perception of a real object, some real object is there. For example, I am having this remote. Okay, I am having this remote and I am just looking at it and I am thinking that this is a sword. Okay, so this remote is changing and feeling like a sword. Okay, so that is illusion. मतलब कुछ ना कुछ अगर है तो illusion है, अगर कुछ भी नहीं है फिर भी दिख रहा है, that is hallucination. Clear now? Okay, one more thing, tell me, emotions are generated from, the formation of emotion will be occurring in, from physiology, try to answer. The formation will be occurring in limbic system. Whatever thing that you are doing, प्यार व्यार सब कुछ, गुस्सा, hate, whatever things that you are doing, सब कुछ क्या है, coming from your limbic system, but they are controlled by your frontal lobe. बच्चों कौन कंट्रोल करेगा? इट विल बी कंट्रोल्ड बाय योर फ्रंटल लोब. सो जनरेशन ऑफ इमोशंस विल बी फ्रॉम लिम्बिक सिस्टम एंड कंट्रोल्ड बाय फ्रंटल लोब. ओके, दे आर कंट्रोल्ड बाय फ्रंटल लोब. ओके, ट्राई टू सॉल्व दिस वन. A 32-year-old male patient presented to OPD with his wife. अपनी पत्नी के साथ में आता है. The patient is telling that he is in love with Alia Bhatt. ओके, इसको आलिया भट्ट से प्यार हो गया एंड शी इज़ ऑल्सो लविंग हिम बैडली. दोनों आपस में प्यार कर रहे हैं. व्हेन हर वाइफ आस्क फॉर द प्रूफ, ही टेल्स दैट समवन हैज़ हैक्ड देयर मोबाइल एंड डोंट लेट एनीवन सी द प्रूफ. ओके, कोई इनको प्रूफ नहीं देखने दे रहा. सो विच ऑफ द फॉलोइंग एक्सप्लेन द कंडीशन ऑफ दिस पेशेंट? तो ये क्या है? Is it Cotard syndrome? Is it D-Clembert syndrome? Is it Othello syndrome? Or is it Bobbitt syndrome? क्या है बच्चों ये? First of all, we are already seeing that this is a patient with delusion. And what kind of delusion is this? Patient is having firm and fixed belief. Okay, patient is having already firm and fixed belief. Okay, what kind of delusion is this? कौन सा delusion है? क्या हो सकता है इस patient को? What can be the situations that are possible here? Try to answer. Nidhi, D. All in one. I think you are mistakenly answering D. That is completely irrational. Nidhi, B. Try to answer guys. बोलो बच्चों. So basically the diagnosis over here is some kind of delusion is there. Okay, delusion तक तो समझ में आया, right? Entertainment C तो नहीं है, बाकी नहीं पता. Okay, try to see here. Let me teach you. Okay, so what is Cotard syndrome? Cotard syndrome is the another name for nihilistic delusion. Nihilistic delusion मतलब सब खत्म हो गया. Okay, delusion of negation, also known as delusion of negation guys. Delusion of negation. Okay, so this cannot be the answer. Second one is your D-Clembert syndrome, also known as erotomania, also known as erotomania, also known as fantasy lover syndrome. फैंटेसी लवर सिंड्रोम, इनको क्या लगता है ना, generally what will happen here, the patient will be coming from a low socio-economic status, okay, the patient will be coming from a low socio-economic status and he will be loving the girl of high socio-economic status, okay. So basically the patient from lower socio-economic status will love person of higher socio-economic status. Okay, so this is the thing that is happening in the declambered syndrome, erotomania और fantasy lover syndrome. यहाँ पर ये क्या बोल रहा है, पेशेंट बोल रहे हैं कि मैं प्यार करता हूँ आलिया भट्ट से एंड आलिया भट्ट इज ऑल्सो लविंग मी बैक, ओके, पर क्या हो रहा है कि रणवीर जो भी मैसेजेस है उनको हैक करा रहा है, उनको पता नहीं चलने दे रहा, राइट. नेक्स्ट वन इज योर ओथेलो सिंड्रोम. ओथेलो सिंड्रोम इज नोन एज डिल्यूजन ऑफ इनफिडिलिटी. बच्चों डिल्यूजन का मतलब समझ में आ गया, वी आर हैविंग डिफरेंट काइंड ऑफ डिल्यूजन्स, ठीक है. सो दिस इज योर डिल्यूजन ऑफ इनफिडिलिटी. इनफिडिलिटी का मतलब क्या हो गया, वी कैन ऑल्सो कॉल इट मोरबिड जेलेसी. यहाँ पर क्या होता है, जो पेशेंट होता है, द पेशेंट विल कम आफ्टर ड्रिंकिंग, ओके, द पेशेंट विल बी हैविंग एल्कोहलिक पेशेंट दिखाएंगे. तो क्वेश्चन स्टेम कैसा होगा वो बता देता हूँ. एल्कोहलिक पेशेंट होगा, होमिसाइड का केस होगा, ही विल बी हैविंग डाउट ऑन हर वाइफ, हिज वाइफ, ओके, उसको अपनी पत्नी पे क्या होगा, शक होगा, सो देयर विल बी ए एल्कोहलिक पेशेंट हु इज हैविंग शक ऑन हर, उसकी पत्नी पे शक होगा. दैट वुड बी योर delusion of infidelity or morbid jealousy, okay, delusion of infidelity or morbid jealousy. And lastly we are having Bobbitt syndrome, okay. Bobbitt syndrome में क्या होगा, female cuts the penis of male patient, okay. कोई सा भी याद कर लो गाइस, वट एवर जिसको जो पसंद है वो याद कर लो, जिसको दिशा पटानी है, जिसको जो भी पटाना है वो पटा लो, ठीक है. सो अल्टीमेटली व्हाट यू हैव टू रिमेंबर दैट इन एग्जाम यू विल बी मार्किंग दीज क्वेश्चंस, राइट, ओके. सो कोटार्ड सिंड्रोम इज बेसिकली, कोटार्ड सिंड्रोम डायरेक्ट लिख देते हैं, बेसिकली इट इज़ अ टाइप ऑफ निहिलिस्टिक डिल्यूजन. इसमें पेशेंट को लगता है सब कुछ खत्म होने वाला है, राइट. डीक्लैम्बर्ट, एरोटोमेनिया, फैंटेसी लवर सिंड्रोम, इसमें क्या होगा, एक पेशेंट किसी हायर सोशो इकोनॉमिक स्टेटस के पेशेंट से बंदे से प्यार करेगा एंड इट इज़ ऑल डिल्यूजन, मतलब ऐसा कुछ है नहीं. अगर आप प्रूफ भी कराओगे देन ऑल्सो ही विल डिनाई बिकॉज इट इज़ अ डिल्यूजन, राइट. नेक्स्ट वन इज योर ओथेलो सिंड्रोम ऑल्सो नोन एज डिल्यूजन ऑफ इनफिडिलिटी. शेक्सपियर का नोवेल भी है इसके ऊपर एंड दैट इज ऑल्सो नोन एज मोरबिड जेलेसी, ओके. यहाँ पर जो पेशेंट होता है वो शक करेगा अपनी वाइफ के ऊपर या वाइफ शक करेगी अपने हस्बैंड के ऊपर, ओके. नेक्स्ट इज योर Bobbitt syndrome. What will happen, the female patient will cut the penis of the male patient. Yes, Bobbitt is very dangerous, okay. Everything is dangerous guys, be safe, okay. Next one is your, a 25-year-old female patient is brought to you, you are the doctor, okay. A 25-year-old female patient is brought to you. Her mother is stating that she do not feel good, उसको अच्छा नहीं लगता, she likes to stay alone, she don't talk with the people. Earlier she used to be very social person, right. When asked with the patient, she stated that the patient she don't feel pleasure in those activities now, and these are the symptoms due to what? They want to know these are the symptoms due to what? So basically what is happening, try to identify. She don't talk, okay. What we know, she don't talk, so that is alogia, okay. She do not feel pleasure in those activities, she is feeling pleasure earlier, so that is known as anhedonia, okay. She is not meeting with the new people, that is asociality. Guys, these are the negative symptoms. What kind of symptoms are they? These are your negative symptoms. ये कैसे symptoms है बच्चों? These are your negative symptoms, okay. These are your negative symptoms. Now what are the different things that we are having in our brain? We are having this is the डोपामीन का पाथवे क्या क्या होता है, लुक हियर, डोपामीन का क्या क्या पाथवे होता है, व्हाट आर द डिफरेंट पाथवेज वी आर हैविंग, वी नीड टू रिमेंबर अबाउट दीज फोर. ओके, वन इज ट्यूबुलो इनफंडिबुलर पाथवे. इससे क्या होगा, ट्यूबुलो इनफंडिबुलर पाथवे से क्या आता है, दैट वुड बी गिविंग यू डोपामीन. ये जो डोपामीन है, इट विल बी इनिबिटिंग. डोपामीन का दूसरा नाम क्या होता है, व्हाट इज अनदर नेम फॉर डोपामीन, दैट इज आल्सो नोन एज प्रोलेक्टिन इनिबिटरी हार्मोन. सो वट एवर एंटीरियर पिट्यूटरी इज रिलीजिंग टीआरएच और टीएसएच, उसकी वजह से प्रोलेक्टिन बढ़ रहा है. दैट प्रोलेक्टिन इज डिक्रीज्ड बाय दिस डोपामीन. डोपामीन अलग अलग जगह से आता है, राइट. सो वन पाथवे इज ट्यूबुरो इनफंडिबुलर पाथवे. Second is your nigrostriatal pathway. This one is concerned with extrapyramidal symptoms. Okay, extrapyramidal symptoms like tardive dyskinesia. So that is concerned with the nigrostriatal pathway. But for questions, the important that we are having is positive symptoms and negative symptoms. Negative symptoms, तो क्वेश्चन में हम लोगों को ऑलरेडी वी आर गिवन विद द नेगेटिव सिम्टम्स. पॉजिटिव सिम्टम्स क्या होगा, हेल्यूसिनेशन हो रहा है, इल्यूजन हो रहा है, डिल्यूशन हो रहा है, दीज आर योर पॉजिटिव सिम्टम्स. ओके, तो यहाँ पर क्या है, दीज आर योर नेगेटिव सिम्टम्स. सो वी विल बी थिंकिंग इन टर्म्स ऑफ नेगेटिव सिम्टम्स. सो व्हाट विल हैपन इन द नेगेटिव सिम्टम्स, यू विल बी हैविंग डिक्रीज और इंक्रीज. first of all, see which pathway is involved, mesocortical. Okay, so first of all, we can already remove these mesolimbic tracts. They are not concerned with the negative system. Mesolimbic are concerned with positive system. Okay, negative system, mesocortical will be concerned. Okay, look here, mesocortical will be concerned with your negative system. You can also remember negative system will be having mesocortical pathway, that is your NMC. NMC क्या करता है तुम लोगों के साथ में, वही ये करता है, ठीक है. सो वट एवर थिंग्स दैट NMC इज डूइंग विद अस, ये हमको क्या कर देता है, दुखी कर देता है, राइट. सो दिस इज गिविंग अस द नेगेटिव सिम्टम्स. ओके, नेगेटिव symptoms. So mesocortical negative symptoms will be there. So यहाँ पर क्या होगा, what will happen in depression, in this case what will happen, there will be increase or decrease. What will happen, there will be decrease in the dopamine in which pathway, कौन से pathway में decrease होंगे dopamine, that is in the mesocortical pathway. Mesocortical pathway. So your answer will be D. अगर positive symptoms की बात करूँ, what will happen, there will be involvement of mesolimbic pathway. Positive symptom mesolimbic, negative symptom mesocortical. याद रहेगा, negative mesocortical. Okay, tuberoinfundibular concerned with your dopamine, that would be dealing with prolactin inhibiting hormone. Okay, and extrapyramidal symptoms, we will be discussing about them in the subsequent class. Just a moment guys, let me mute it. समझ में आ गया. ओके, क्या करोगे, नेगेटिव सिम्टम्स को ट्रीट करने के लिए इंक्रीज कर दोगे किसको, डोपामीन को. यू नीड टू इंक्रीज द डोपामीन. ओके, कैसे करोगे, वी आर हैविंग फर्स्ट जनरेशन, सेकंड जनरेशन एंटीसाइकोटिक्स वी आर हैविंग, राइट. So answer here will be decreased dopamine in mesocortical pathway will lead to which symptoms, your negative symptoms. These are your negative symptoms. Okay, next one, a 29-year-old female presented to you by her husband. The lady is delivered a baby 6 days ago, but the mother has delivered a baby 6 days ago via normal vaginal delivery. Now the husband is complaining that she is crying whole night. Okay, she could not sleep, she is having insomnia, and she don't eat anything, and she always feels very low. General physical examination of this particular patient are normal. यहाँ पर सब चीज़ें कैसी आ रही है, नॉर्मल आ रही है. No other findings were there. Which of the following term will best describe the condition? Class will be ended by 9:30, I guess 9:30. We will be having 100 questions from your psychiatry. We will be completing everything. Almost done with 15. 18 questions are almost done. Okay. 18 slides are done. Okay. So a 29-year-old female patient presented to you by her husband. देखो क्या क्या हो रहा है, उसका पति लेके आ रहा है. शी इज हैविंग अ नॉर्मल वेजाइनल डिलीवरी. कब हुई थी डिलीवरी, 6 days ago. फर्स्ट ऑफ ऑल द इंपॉर्टेंट थिंग दैट यू हैव टू रिमेंबर, एक मदर है, शी इज हैविंग postpartum something, postpartum blues can be there, postpartum depression can be there. These are the questions, you know, if you know the trick, you will be answering them very nicely. Okay, if you know the trick, then you will be answering. Otherwise you will be doing, you know, you will be doing the guesses, right? So that is why it is important guys to see how to solve these questions. Okay, so First thing that symptoms, you can see the patient is crying whole night. Okay, she could not sleep. That means the patient is having insomnia. She is not eating anything. She is not eating anything means what? She is having problem with the eating as well. Okay, and there is no other finding. There is no other finding. So how we will differentiate between postpartum blues, postpartum depression and postpartum anxiety? इन तीनों में कैसे differentiation करना है? Now let's see. Okay, now let's see. The first one is your postpartum blues, second one is your postpartum depression, and third one is your postpartum psychosis. So blues में क्या होगा? It will be seen first 2 weeks, or you can remember first week. Okay, so postpartum blue will be present in first week of the postpartum life. Okay, symptoms will be irritability will be there, anxiety will be there, fluctuation, mood fluctuation, increase emotional reactivity. Why these symptoms are occurring? Because there will be some problem. What is the problem? There will be some changes in the hormones. Okay, there will be some changes in the hormones, and because of that, what is happening? The patient is having some sort of symptoms, right? Second, they are mild and spontaneously they will be remitted. मतलब ये अपने आप भी ठीक हो सकते हैं, right? So these are the postpartum blues. First thing that you have remembered, it will be coming in the first or second week of the life, right? Second one is your postpartum depression. Depression is coming, depression कब होगा? जब बहुत ज़्यादा time हो जाएगा. What is the time? That is 13% mother in first year of postpartum. Okay, so it will take approximately 6 weeks to 6 months of time. You can remember like that. Okay, तो इसमें ज़्यादा time लगेगा, right? What are the symptoms? The patient will be having excessive guilt will be there. The patient will be having guilt. Patient will be having anxiety, anhedonia. You already know what is anhedonia. Patient will be having depressed mood, insomnia, hypersomnia, suicidal ideation. That is the important one. Suicidal ideation. Okay, there will be having moderate to severe symptoms, and prolonged course will be there. Okay, lastly we are having postpartum psychosis. Psychosis will be coming in 2 to 6 weeks, guys. 2 to 6 weeks in first 3 months. Okay, 6 to 8 weeks you can also remember. In different books they are given different. Okay, so that would be first 3 months. Okay, symptoms will be mixed or rapid cyclings will be there. Okay, you will be having agitations, delusions, hallucination. That means these are your psychotic symptoms. Okay, patient will be having disorganized behavior, cognitive impairment, and low insight. Low insight means patient herself does not know that whether she is ill or not, right? Next, they are considered severe and you really need to have hospitalization in this case. Okay, so these are the important keywords that you need to remember. What is postpartum blues, what is postpartum depression, what is postpartum psychosis. Okay, कैसे treat करोगे? First thing, postpartum blues are generally self remitting. Okay, they will be treated by self. Okay, depression or psychosis, we already know the treatment. Okay, we already know the treatment. So what is this case? Try to answer this one. What is this case, guys? She has delivered the baby when 6 days ago. 6 days ago, that means it is a week. Then your answer will be, guys, what would be your answer out of them? एक हफ्ता हुआ है. Your answer will be, एक हफ्ते में क्या आंसर करोगे? What we have seen, look here, what we have seen, if it is 1 week or 2 week, your answer will be blues, postpartum blues. Depression will take time. Depression will take approximately a year, and then second will be your 2 to 6 weeks. That means in between if the time period is given, that would be your psychosis, and that needs hospitalization. Okay, psychosis needs what? Hospitalization of the patient, right? So in this case, your answer will be A. Very good. Your answer will be A. That is your postpartum blues. Okay, postpartum blues. Next one, try to answer this one. A patient with schizophrenia is admitted to hospital when the nurse entered the room for injection. अभी nurse injection लगाने आ रही है. The patient started fighting with her. Patient उसके साथ में लड़ाई करने लग गया. And what he is saying, stating that she is her wife and she comes to harm me. Which of the most likely diagnosis over here? What is the diagnosis, guys? Is it a Capgras syndrome? Is it a Fregoli syndrome? Delusion of grandiosity? These are all the important points that I've gathered for you. So, how you will remember? Try to answer first. Is it Fregoli syndrome, Capgras, syndrome of subjective doubles, syndrome of subjective doubles, or is it a delusion of grandiosity? How you will identify? बोलो बच्चे. कैपग्रास, कैपग्रास, कैपग्रास में क्या होगा? जस्ट रिमेंबर वन. ऐसे जो दो सिंड्रोम होते हैं जिनमें कंफ्यूजन होता है, उनमें से एक याद रख लो, दूसरा अपने आप हो जाएगा. ओके, सो कैपग्रास, एनीवन यू कैन रिमेंबर. कैपग्रास पीपल विल फाइट इन फैमिली. ये कहाँ लड़ेंगे? ये घर पे लड़ेंगे. दीज पीपल विल फाइट इन फैमिली. इनको क्या होता है? दे विल बी, दे रेफर फैमिली एज स्ट्रेंजर्स. ओके, दे रेफर फैमिली एज स्ट्रेंजर्स. इनको अपने ही पराये लगने लगते हैं. इनको यू कैन रिमेंबर, हिंदी में भी याद कर लो. इनको क्या होता है? अपने ही इनको पराये लगने लगते हैं. सो दीज आर द कैपग्रास सिंड्रोम. दीज पीपल विल बी फाइटिंग इन द होम इटसेल्फ, राइट. वो घर जाएगा, घर जाके अपनी ही बीवी से लड़ेगा. ही विल बी फाइटिंग और बोलेगा कि यू आर नॉट माई वाइफ, यू आर समवन एल्स जस्ट लुकिंग लाइक माई वाइफ, राइट. सो दीज आर द कैपग्रास सिंड्रोम. फ्रेगोली में क्या याद रखना है? फ्रेगोली वाला गोली देंगे. कौन गोली देंगे? घर वाले. ओके, घर वाले गोली देंगे. सो बेसिकली these are the people, they will be fighting in public. They will be fighting in public. इनको क्या लगेगा? इनको लगेगा घर वाले क्या दे रहे हैं? गोली दे रहे हैं. सो बेसिकली they will be referring strangers as family. इनको क्या होता है? सब अपना लगने लग जाता है, राइट. सो दीज आर द पीपल हु आर फाइटिंग वेयर दे विल बी फाइटिंग इन द पब्लिक. लाइक हियर this person is fighting in the hospital, right. So this is your फ्रेगोली सिंड्रोम. इसको नर्स भी क्या लग रही है? अपनी पत्नी लग रही है. इसको दूसरे लोग भी अपने लगने लग रहे हैं, राइट. सो दैट इज द फ्रेगोली सिंड्रोम. कैपग्रास में क्या होगा? अपना भी पराया लगेगा. जस्ट रिमेंबर लाइक दैट, यू कैन रिमेंबर, राइट. ओके, सिंड्रोम ऑफ सब्जेक्टिव डबल्स में क्या होता है? द पर्सन विल थिंक लाइक, फॉर एग्जाम्पल आई विल बी थिंकिंग लाइक मेरे जैसा एक और बंदा है, वो अपनी अलग जिंदगी जी रहा है. सो बेसिकली द people will think like he is having doppelganger with same kind of appearance. So that is the syndrome of subjective double. And delusion of grandiosity, you already know that is basically what is that. Okay, इसको लगता है that I am the god. Okay, so here the answer will be Fregoli. Now अभी याद रखोगे, फ्रेगोली और कैपग्रास में डिफरेंशिएट कर लोगे. फ्रेगोली मतलब क्या होगा? फ्रेगोली वाला बंदा कहाँ पर लड़ेगा? दे विल बी फाइटिंग इन द पब्लिक. ओके, दे विल बी फाइटिंग इन द पब्लिक. इनको क्या लगता है? सब अपने लगते हैं इनको. ही विल बी हैविंग, सब अपने लगते हैं इनको. यू कैन रिमेंबर लाइक दैट. ओके, नेक्स्ट वन. A 17-year-old girl is presented to OPD with the complaints of excessive exercising. Okay, now I think you must have got it. Okay, and dieting and irregular periods. On further examination, the patient is having calocinicals and the BMI is 17.5. What is the most likely diagnosis over here? एक 17 साल की लड़की है. शी इज हैविंग कंप्लेंट्स. व्हाट आर द कंप्लेंट्स? शी इज हैविंग कंप्लेंट्स ऑफ एक्सेसिव एक्सरसाइजिंग. फर्स्ट थिंग, शी इज एक्सरसाइजिंग अलॉट. सेकेंड थिंग, शी इज हैविंग डाइटिंग. Third thing, she is having irregular period, and lastly we are having BMI that is 17.5. What you will be suspecting, guys? Why you guys are always confused between two options? Remember, guys, that is why I always suggest you to eliminate the options. Okay, elimination is the best way to get the answer. Okay, exam में क्या होता है? 4 options are there and answer is also there. Question तो होता ही है, साथ में answer is also there. You just need to eliminate 3 options, 3 wrong options, and ultimately you will be getting to your answer. Okay, तो यहाँ पर those people who are already confused in bulimia nervosa and anorexia nervosa, what is the thing that you have to see? You have to see for the BMI. अगर BMI कम है, if the BMI is less, that means patient कैसा होगा? BMI का normal value कितना होता है? What is the normal value of BMI? Try to answer. What is the normal value of BMI? BMI is your 18.5 to 24.9, right? So BMI 18.5 से अगर कम है, that means this patient will be underweight. Okay, so अगर if the patient is underweight, your first option will be ruled out, right? So those people who are confusing between bulimia and anorexia और थोड़ा बहुत idea है, तो bulimia patient will be normal, right? She will not be having any kind of underweight symptoms, right? So if the patient is underweight, that means it is a case of anorexia. Okay, what is binge eating disorder? What is avoiding restrictive food intake disorder? Let me teach you. The patient is having calocinicals. इनका मतलब क्या होता है? What is calocinical? This has been once asked in your examination. So let's see what are the different kind of disorders that we are having, which okay. Very good. Okay, so what are the different kind of disorders that we are having? Normal BMI will be 18.5 to 24.9, right? That is your normal BMI, right? So first patient, look here, anorexia nervosa patient कैसा दिख रहा है? Patient will be thin, okay? But patient has a problem with perception. Remember what I've told you, how we are perceiving, right? So patient will be having abnormal perception of the body, of the weight. इसको लगता है she is very thick, right? So that is why she is doing dieting, she is eating less food. Okay, this patient will be having low BMI, that is 17.5, that is given in the option. Okay, these are the symptoms that you will be finding in this particular patient. Okay, bulimia nervosa patient, on the other hand, she will be looking fit and fine, she is fine, right? Weight of this particular patient will be normal or abnormal? The weight will be normal, guys, here, right? And this is your binge eating disorder. What is binge eating disorder? Look at these people. ये वो है जो 50 रुपए की अगर थाली मिल रही है तो उसमें कुछ नहीं छूटना चाहिए, राइट? दे आर ईटिंग एवरीथिंग. binge eating people, binge eating is the most common type of eating disorder. If they ask you, then your answer will be binge eating disorder. ये लोग खाते रहते हैं, ये लोग खाते ही रहते हैं बस, ठीक है? So calocinicals is basically why people are having calocinicals. Try to see here, look here. Basically this anorexia nervosa patient, what she is doing, she is eating something, appetite normal होगा तो she's eating something. After eating, what she will be thinking, sir, my weight is too much, I need to decrease the weight. Okay, so what she is doing, she is putting her hands, okay, and she will purge it out. Okay, so she will be doing vomiting, that is purging. And because of that purging, what will happen? Because of constant purging, what will happen? Knuckles will be having contact with the acid, and that would be providing as calocinicals. So the patient will be presenting with calocinicals. So when you look at the knuckles of this particular patient, because of constant touching with the acid, okay, acid की वजह से what will happen? You will be having this type of calocinicals. Okay, binge eating disorder is the most common type of disorder. Eating disorder. This is the most common type of eating disorder that you will be finding in these patients. Okay, you will be finding in these patients. Okay, next we are having avoidance restrictive food intake disorder. Try to answer what is that. In this, what will happen? The patient will significantly decrease the volume of food that he or she is taking. Okay, so significant, they will be decreasing the volume. Why they are decreasing the volume? Not because they are having some kind of psychiatric disorder, but because of smell of food, because of type of food or texture of food they don't like. That is why they are decreasing the volume. That is your avoidance restrictive food intake disorder. Okay, guys. Next one. A 19-year-old girl brought to the OPD with the complaints of recurrent episodes of increased cardiac contractility. We already know what is increased cardiac contractility. That is your palpitation. Sweating is there. Insomnia is there. The patient is not able to sleep, right? Problem in breathing. She is having problem in breathing, and when she feels the symptoms, she is having a feeling of impending doom. Very characteristic word. That is a buzzword. What is the likely diagnosis for this particular situation? What is the likely diagnosis for this particular situation? Here the answer will be B, guys. What is the likely diagnosis for this particular situation? Yes, Pachu. Is it a panic attack? Is it a PTSD? Is it a panic disorder or generalized anxiety disorder? Okay, these are all the symptoms that we are getting. These are the symptoms of anxiety. We already know these are the symptoms of anxiety. Okay, these are the symptoms of anxiety. How you will identify whether it is a panic attack, whether it is a panic disorder, or it is a PTSD, or it is a GAD. Anxiety is there. Panic attack, legendary Ritvik, AK, panic attack. What if I say the answer is C? What if I say the answer is C? It is not a panic attack. Look here, guys. If anxiety is present, look here. If anxiety is present and patient is having a multiple episode, we call it generalized anxiety disorder. Okay, multiple times the same things is happening, but these things are not there in the GAD. Okay, patient is having little bit of anxiety every time she is having palpitation. Okay, sweating is there, insomnia is there. Okay, so normally we are having anxiety. Look here, we are having, if there is intense anxiety, we call it panic attack. Wait, guys, if there is intense anxiety along with the feeling of impending doom, yes, you guys are right, Nidhi. Let me tell you, if there is feeling of impending doom is there along with intense anxiety, we call it panic attack. But in the question, look here, guys, in the question we are having recurrent episode. If there is recurrent episode of, this is the question that has been asked in your examination. Okay, if there is recurrent attacks, if there is recurrent attacks which are present, we call it panic disorder, guys. Panic disorder, this is known as panic disorder. Okay, yes, that is why it is important to read the question carefully. Okay, if there is feeling of impending doom is given only, then your answer will be panic attack. Your answer will be panic attack. But along with the panic attack, if they are giving multiple recurrent panic attacks are there, we call it panic disorder. We call it panic disorder. Okay, PTSD, we have already seen. PTSD will be after a traumatic or any kind of stressful event. Traumatic or stressful event, what will happen here? The patient will be having intrusive symptoms, patient will be having arousal symptoms, patient will always be hyper vigilant. Okay, if guys, if these symptoms starts after 6 months, if these symptoms starts after 6 months of the trauma, after 6 months, what do we call it, guys? We call it, try to answer, we call it delayed type of PTSD. We call it delayed type of PTSD. Okay, so basically that is known as delayed type of PTSD. Clear, guys? Is that clear? Is that clear to all of you? Okay, next one. A 45-year-old patient is having issues with neighbors from last 5 years. These neighbors are having issues. Okay, the patient is having issue with the neighbors for last 5 years. He will always think that they want to harm him. इसको लगता है the neighbors tries to harm him. He also hears some voices which are inaudible by others. Okay, so basically whenever they will talk in terms of third person, right, that is some voices are always telling us about the auditory hallucination. Okay, so he is having some voices. Diagnosis of schizophrenia was already made. Okay, this particular person is having schizophrenia, right, was made, and he started on a drug which is haloperidol. After last night dose, his eyes are rolled up, उसकी आंखें चढ़ गई है. After a few hours, he was brought to the emergency. What is the drug this patient is needing now? Basically, what are the things that they have already given me, right? The patient thinks the other people wants to harm him, so basically this is delusion of persecution. Basically this is the most common delusion of persecution. Apart from that, patient is having some kind of hallucination, that is basically auditory hallucination is present. Okay, and this will make the diagnosis of schizophrenia. The patient is having schizophrenia, and schizophrenia patient are given some drugs, right? And these drugs are haloperidol. These are typical antipsychotic, peridol. And now what is happening to the patient? His eyes are rolled up. Can you try to answer what is happening? What is happening over here? What is happening over here? Generalized anxiety disorder without feeling of impending doom. If mild symptoms are there for a long period of time, that is GAD, right? So patient is having haloperidol. Okay. So patient is having haloperidol, and now they wants to know what is happening to the patient. First of all, rolling up of eye is known as, it is a basically, what is your diagnosis over here? Try to answer what is your diagnosis, guys. Diagnosis is simple. The patient is having extra pyramidal symptoms. Just wait a minute, guys. The diagnosis is simple over here. The patient is having extra pyramidal symptoms. Okay, patient is having extra pyramidal symptoms. Very good. Okay, so what are the things that we are using? Look here, guys. We are having haloperidol. Haloperidol is a first generation or second generation antipsychotic. So we are having first generation antipsychotic, we are having second generation antipsychotic. Okay, so basically those antipsychotics which are working on D2 receptor, mainly D2 inhibitor, they are known as first generation antipsychotics. Okay, they will be generally we are using for these positive symptoms. Okay, and the side effect is important, like haloperidol, droperidol. Okay, these are the drugs which are coming on under first generation. The most common side effect that you are getting from this is your extra pyramidal symptoms, and every year there is a question from this extra pyramidal symptoms. Second generation antipsychotics basically working against negative symptoms. Okay, they will be blocking D2 receptors. Along with that, they will be blocking 5-HT2A receptor. 5-HT2A receptor. These are basically serotonin receptors. Okay, so they will be working against negative symptoms. And what is the most common side effect that you will be finding? That is your metabolic side effects. Okay, so here the patient will be having metabolic side effects. What are metabolic side effects? Side effects like the patient will be having weight gain, patient will be having hyperlipidemia. Okay, hypercholesterolemia. Okay, so patient will be having weight gain, hyperlipidemia, all your side effects. So these are the side effects that you will be finding with the second generation thing. Okay, now what will happen? Look here, the extra pyramidal side effect that we are having, and the most important slide, every year there is a question from this. This is the extra pyramidal or neurological symptoms that you need to remember. First one is your acute dystonia, guys. Acute dystonia is the earliest side effect. They have asked you a question, which one is the earliest side effect, then your answer will be acute dystonia. Okay, what will happen in acute dystonia? Try to see here. This is the earliest side effect you will be finding in 1 to 5 days. Okay, uncontrolled muscle spasm. You will be having uncontrolled muscle spasm, mostly over face, tongue, or neck. That is, the patient can have torticollis, patient can have rolling up of eyes. That is the earliest side effect that the patient can have. Okay, how you will treat this particular situation? You will be using a drug that is known as promethazine. You can also use benzhexol. ये दो दवाई हम लोग यूज में ले सकते हैं, बेसिकली एंटीकोलिनर्जिक है. इसकी वजह से क्या होगा? D2 रिसेप्टर को ब्लॉक कर देंगे, डोपामीन कम हो जाएगा. देयर विल बी अ डिजीज नॉन एज पार्किंसोनिज्म कैन हैपन. एंड फॉर ट्रीटमेंट ऑफ पार्किंसोनिज्म ऑल्सो वी आर गिविंग व्हाट? We are giving benzhexol. What is Parkinsonism? You will be having, patient will be having symptoms like rigidity will be there, bradykinesia, rigidity will be there, patient will be walking very slowly. Okay, and patient will be having tremors. Okay, for that purpose also we are giving benzhexol. Very very important slide, guys. Every year there are questions from this. Next one is your akathisia means the patient will be having restlessness. Okay, patient will be running here and there. Okay, patient will be having running here and there, and this is the most common symptom. So second question they will ask you is what is the most common symptom? That is your restlessness or irresistible desire to move around. Okay, and how we will treat it? We will be treating it with the help of beta blocker, that is your propranolol. Propranolol or beta blocker is the drug that we are using. Next one we are having is malignant neuroleptic syndrome. That is the thing, and in this what will happen, basically same thing will happen like malignant hyperthermia. Here they will be having increased levels of calcium that would be leading to muscle rigidity. Patient will be having fever, unstable BP, and myoglobinemia. And the drug of choice will be same again, that is your dantrolene. IV sodium dantrolene is the drug that we are using for neuroleptic malignant syndrome. And tardive dyskinesia, tardive का मतलब होता है लॉन्ग टर्म, tardive का मतलब क्या होता है, long term. That would be seen when the patient is on the drugs for long term, that is for months and years. Okay, so you will be having involuntary painless movements of the face. Okay, so that is the tardive dyskinesia, and the drug of choice that we are using for tardive dyskinesia will be, we can use valbenazine, we can also use tetrabenazine or valbenazine. Okay, very good guys. So that is about the this question. Okay, so what we are going to do, we are going to treat extrapyramidal symptoms. Treatment of extrapyramidal symptoms will be injection promethazine, which is also a anticholinergic drug. Okay, हम लोग क्या करेंगे, we can give a anticholinergic drug that would be helping us to decrease the symptoms. Okay, इसके देने के बाद में basically you know what happens, a patient is coming to us, हम उसको haloperidol लगाते हैं. The first side effect that we will be seeing first और अर्लीस्ट इज एक्यूट डिस्टोनिया. क्या होता है, पेशेंट अपनी आंखें ऊपर कर लेगा, राइट. सो व्हाट वी कैन डू, हम लोग क्या करना है, पेशेंट को एक प्रोमेथाजीन या फेनार्गन कोई सा भी इंजेक्शन लगा दो, पेशेंट विल बी ओके विद इन 5 मिनट्स. ओके, 5-7 मिनट में पेशेंट आपका ठीक हो जाएगा. दैट वुड बी promethazine. Okay, and these are your extrapyramidal symptoms most commonly asked. Every year there is a question from this, right? Next one, try to answer this one. A 32-year-old male patient who is a known case of generalized anxiety disorders presented to the emergency with the complaints of feeling of impending doom. Okay, the preferred drug for this particular patient would be, क्या दवाई दोगे, पेशेंट इज ऑलरेडी केस ऑफ जनरलाइज एंजाइटी डिसऑर्डर, उसको नॉर्मली एंजाइटी तो होता था. नाउ व्हाट इज हैपनिंग, द पेशेंट इज हैविंग फीलिंग ऑफ इम्पेंडिंग डूम. व्हाट इज द मीनिंग ऑफ फीलिंग ऑफ इम्पेंडिंग डूम, दिस पेशेंट इज हैविंग व्हाट नाउ यू मस्ट बी अंडरस्टैंडिंग, दिस पेशेंट इज हैविंग नाउ पैनिक अटैक. इस पेशेंट को क्या हो रहा है, पैनिक अटैक आ रहा है. नाउ हाउ यू विल ट्रीट दिस पर्टिकुलर पैनिक अटैक, पैनिक अटैक विल बी ट्रीटेड बाय propranolol, paroxetine, fluoxetine or alprazolam. Try to answer guys, what is the most common, if they ask you most common group of psychiatric disorder, if they ask you most common group of psychiatric disorder, most common group of psychiatric disorder, then your answer will be what? Okay, and if they ask you most common psychiatric disorder, if they ask you most common psychiatric disorder, then your answer will be what? Try to answer this. Okay, what you will do in this particular case guys, why you guys are giving fluoxetine, feeling of impending doom is there. These SSRI, these SNRI, they will take time. Okay, इनका level maintain होने में time लगता है. Okay, so what are the drug that we can use? We can use here benzodiazepine. Alprazolam is a benzodiazepine. Okay, what will happen, ये क्या करेगा, ये GABA को बढ़ा देगा. Basically GABA is an inhibitory neurotransmitter. What will happen, your body will be having inhibition, right? Inhibitory neurotransmitter है तो brain को क्या कर देगा, शांत कर देगा. So that is why we can use this thing alprazolam. We can also use it along with the combination of like propranolol, right? So we can use it like that. Okay, treatment per se guys, we can give psychotherapy, we can also use pharmacotherapy, we can give psychotherapy along with pharmacotherapy. Just remember guys, for short term patient, short term अगर कोई patient है, short term we need to treat any patient, we will be giving benzodiazepines. For long term what we will be giving SSRI. मतलब जैसे ही पेशेंट आएगा एक्यूट सिचुएशन के साथ में, व्हेन द पेशेंट इज हैविंग एक्यूट सिचुएशन, व्हाट वी विल बी गिविंग, वी विल बी गिविंग बेंजोडाइजेपिन्स। उसके बाद में हम लोग क्या करेंगे, अलोंग विद द बेंजोडाइजेपिन्स वी विल बी शिफ्टिंग आवर पेशेंट टू एसएसआरआई। इनको वर्क करने में अप्रोक्सीमेटली 7 days लगेंगे, राइट। सो टिल द टाइम इट विल अटेन द नॉर्मल लेवल ऑफ द ड्रग इन द बॉडी, तब तक क्या होगा, बेंजोडाइजेपिन्स विल बी टेकिंग केयर ऑफ द other things. Okay, so this is how we are using both the things. Okay, so most common group of psychiatric disorder, if they ask you, then your answer will be anxiety disorder, guys. Anxiety disorder. Okay, and most common psychiatric disorder, if they ask you, that is individual, then your answer will be specific phobias. Specific phobias. Specific phobias. Then your answer will be which? Specific phobias. If they ask you most common psychiatric disorder, answer will be specific phobias. Okay, what are the classes of drugs that we are having? We are having SSRI, that is selective serotonin receptor inhibitor. Okay, we are having SNRI, that is serotonin norepinephrine receptor inhibitors. Okay, reuptake inhibitors. Next we are having, we can stimulate the receptors of serotonin. We can use MAO inhibitors. MAO is the enzyme that is doing the metabolism, right? Lastly we are having tricyclic antidepressant. Okay, these are the example you should be remembering. Okay, इनमें से examples में से अगर question आता है, for example like we are having deloxetine and fluoxetine, they are similar looking but both of them are from the different classes. Okay, venlafaxine and other will be same. Okay, so just remember this one, deloxetine is an example of, just remember deluxe van. Okay, तो एनआरआई लोग किस में घूमते हैं, डीलक्स वैन में घूमते हैं. ओके, सो यू कैन रिमेंबर एनआरआई विल बी, एसएनआरआई विल बी डिलॉक्सिटिन एंड वेनलाफैक्सिन. ओके, बाकी सारे फ्लोक्सिटिन, बाकी सारे परोक्सिटिन, बाकी सारे जितने भी है डेपोक्सिटिन, ऑल दीज विल बी कमिंग अंडर एसएसआरआई. ओके, एसएसआरआई का एक साइड इफेक्ट होता है, दैट इज योर साइड इफेक्ट. क्या होता है, व्हाट इज द साइड इफेक्ट ऑफ एसएसआरआई, ट्राई टू आंसर. कहाँ पर हम इसको यूटिलाइज कर सकते हैं, व्हाट इज द साइड इफेक्ट ऑफ एसएसआरआई, ये क्या कर देता है. ओके, ट्राइसाइक्लिक एंटी डिप्रेसेंट जो होते हैं ये कार्डियोटॉक्सिक होते हैं, दे आर वेरी कार्डियोटॉक्सिक, दे कैन कॉज मायोकार्डियल प्रॉब्लम्स, राइट. सो दैट इज द इम्पॉर्टेंट थिंग यू हैव टू रिमेंबर, राइट. नेक्स्ट वन, a 20 nausea vomiting is the side effect of everything, important side effect you have to answer, guys. A 21-year-old male patient used to go to club on regular basis and the next day when he woke up he had fever. Patient को क्या हो रहा है, fever आ रहा है, myalgia, pain in the body, diarrhea, runny nose. He was continuously yawning and examination reveals, what the examination is revealing, pupillary dilation is there. Okay, what is the most probable diagnosis here? Not low libido, guys, it will be increasing your libido. Okay, two things are there, one is erectile dysfunction. For treatment of erectile dysfunction, what you are using sildenafil. You are using sildenafil, which is a 5-phosphodiesterase inhibitor that would be causing vasodilation, और उसकी वजह से क्या होगा, lots of blood will be coming in the organ and what will happen, because of that you will be having good erection. So that is another thing, erection is a different thing. Second thing is your sex drive, or you can say libido. Okay, so it will be treating your premature ejaculation. That would be, if there is low libido, that would be leading to premature ejaculation. So for premature ejaculation we can use drugs like SSRI. इनसे क्या होगा, इनसे it would be leading to increase in time of ejaculation. It will be causing a side effect that is known as delayed ejaculation. It will be causing a side effect that is known as delayed ejaculation. Okay bachcho, it will be causing delayed ejaculation, right. So we can use these drugs in the patient who are having premature ejaculation. Okay, but these drugs are not working, these drugs are working after 7 days. They are not working directly, एक ले ली गोली और काम हो गया, ऐसा नहीं है. You need to have complete course, okay, under the guidance of a doctor, right. Next one, तो यहाँ पर what are the symptoms that you are finding over here? We are having fever, the patient is having fever, patient is having myalgia बच्चों, Patient is having diarrhea, runny nose, and pupillary dilation. Okay, what is the thing that you are suspecting over here? LSD withdrawal, अगर LSD withdrawal की बात करूँगा, you will be having a side effect that is known as flashback phenomena. Very very characteristic. You will be having flashbacks in the LSD. So LSD cannot be the answer. But all these symptoms, can you appreciate? These are flu-like symptoms. These are all your flu-like symptoms. Like patient is having lacrimation. Okay, patient is having rhinorrhea. Okay, patient is having yawning. So these are the flu-like symptoms. And flu-like symptoms, whenever we will talk in the terms of flu-like symptoms, it is due to toxicity or is it due to withdrawal? Remember guys, this is due to withdrawal. Okay, so whenever you are having opioid, heroin is a opioid, so whenever you are having opioid withdrawal, you will be having what kind of symptoms? Flu-like symptoms. Remember, from now onwards you will be having flu-like symptoms. Okay, flu-like symptoms, right? Next thing you have to remember about alcohol withdrawal. Alcohol withdrawal में you will be finding multiple things. क्या क्या होगा in alcohol withdrawal? You can have tremors, बच्चों. You can have hallucinosis. Okay, the patient can have seizures. The patient can also have delirium tremens. So these are the symptoms that you will be finding in the patient of alcohol withdrawal. Yeah, alcohol withdrawal में मिलेगा. Whenever we will talk in the terms of heroin toxicity, you must have studied about the mnemonic sacrum, right? So that is the heroin toxicity. Let's see what are the symptoms you will be finding in withdrawal and how you will differentiate it with the intoxication. Okay, intoxication में क्या होगा? Remember guys, in intoxication you will be having constricted pupils. Okay, this is how we are using it for the differential of organophosphate poisoning. OP poisoning जो patient होता है उसके अंदर भी constricted pupils मिलते हैं, but how you will differentiate based on the clothes. Symptoms will be symptoms will be also different, but most likely how you will be differentiating this constricted pupil, you will also find that constricted pupil in the patient of organophosphate poisoning. Can anyone answer me what is the drug of choice for organophosphate poisoning? Okay, here the patient will be having drooping of eyelid, there will be decrease in the respiratory rate. Okay, that is very important guys. Remember, in anesthesia also we have discussed opioids are respiratory depressant. Okay, respiratory depressant. So opioids will be causing what? Whenever there is intoxication, बहुत सारा opioid अंदर चला गया, बहुत सारा heroin अंदर चला गया, what will happen? The patient will be having decreased respiratory rate, right? Patient will be having scratching due to histamine release. Patient will be having scratching, right? And patient can have head nodding as well. Okay, withdrawal symptoms, basically they will be flu-like symptoms. Patient will be restless, irritability will be there, anxiety will be there. In yawning you can appreciate, vomiting, diarrhea, abdominal cramps. Important one is dilated pupil. Just remember, dilated pupil will be seen in, very good guys, atropine is the drug of choice for organophosphate poisoning. But if there is poisoning of atropine, if there is poisoning of belladonna, if there is poisoning of datura, what is the drug of choice then? Try to answer now. Opposite question. Okay, in those atropine, belladonna, datura poisoning, what will happen? There will be dilated pupil. Along with that, in withdrawal, opioid withdrawal also, you will be finding dilated pupil, and you will be having sweating. Along with that, piloerection, you will be having goosebumps. Okay, you will be having goosebumps. So these are the characteristic findings that the patient that the examiner can give you in the exam. Very good guys, very good. Physostigmine, and very good Sahana. Yes, we are using atropine plus PAM. PAM is basically pralidoxime. Okay, PAM and atropine are the drug we are using. So what is the case here? Here it is the case of heroin withdrawal. It is the case of heroin withdrawal. You can appreciate it, right? Next one. A 25-year-old patient with a history of smoking, chronic alcohol intake, patient बहुत सारी दारू पीता है. The patient is presented to OPD with the complaints of cough in the sputum. सिगरेट पिएगा तो कफ तो आएगा, right? Now, and he has already concluded, remember guys, look here, he has already concluded that he has cancer. उसने पहले ही मान लिया है, उसने इतनी सिगरेट पी है, उसको पता है उसको कैंसर है. And he asked for investigation. On further examination, the patient is found to be normal. हमने टेस्ट किए, बट द पेशेंट इज फाउंड टू बी नॉर्मल, बट ही डिड नॉट बिलीव द डॉक्टर. He already had asked he already had visited multiple hospitals, and He has already visited multiple hospital, multiple doctors for the same situation. Which of the following can be most suited diagnosis for this particular patient? Now again I'm getting A, B, C. Why you guys are answering differently in psychiatry? Is it difficult to understand psychiatry? It is a simple thing when you try to connect it with other things. Okay, जब आप इसको दूसरी चीज़ों से connect कर लोगे, you will be understanding it very better, right? So इसको connection बनाना सीखो, right? Somatization disorder. Remember guys, look here, let me help you. So what is hypochondriasis? Hypochondriasis is basically, you can say, illness anxiety disorder. It is a illness anxiety disorder. So here the patient will already having the diagnosis. Very important, the patient is preoccupied with the diagnosis, guys. Very very important thing, the patient is preoccupied with diagnosis. Yes, this is a illness anxiety disorder and the patient is preoccupied with diagnosis. Those people who are answering somatization disorder, look here, what will happen in somatization? The patient is preoccupied with symptoms. Okay, preoccupied with symptoms, preoccupied with symptoms, not disease but symptoms will be there. Okay, Munchausen syndrome, what is the another name? Munchausen syndrome will be factitious disorder. Factitious disorder. ओके, फैक्टिशियस डिसऑर्डर, यहाँ पर पेशेंट को पहले से ही सारी चीज़ें पता होती है, राइट? ही इज़ मे बी ए मेडिकल प्रोफेशनल, ही इज़ हैविंग सम काइंड ऑफ मेडिकल बैकग्राउंड. इनको क्या चाहिए होता है? दीज आर द पीपल हु वांट्स मेडिकल अटेंशन. ओके, इनको क्या चाहिए होता है? अटेंशन चाहिए होता है. दैट इज़ वाई they are going to hospital. Okay, they are going to hospital. What is somatoform pain disorder? Malingering का मतलब होता है झूठ बोलना. ओके, malingering झूठ बोलने के लिए. हियर यस, द पेशेंट विल बी हैविंग सिक रोल. पेशेंट को क्या होता है? मजा आता है जब सब लोग आके उसका ध्यान रखेंगे, तो पेशेंट विल बी हैप्पी. दैट इज वाई ही इज विजिटिंग द हॉस्पिटल. ही रिक्वायर्स मेडिकल अटेंशन. ओके, somatoform pain disorder, remember guys, here the patient will be having chronic pain. The patient will be having chronic pain without any physical issues. Okay, without, patient will be having chronic pain without any physical finding, without any, this is a painful condition without any physical finding, without any physical finding. So these are the types of patient which are having somatoform pain disorder. Now try to answer. What would be your answer, guys? Try to answer. Is it a hypochondriasis? Yes, because the patient is already having the diagnosis, guys. These are the important points. Remember, guys, if you understand how to identify keywords, your life will be easy, guys. You will be easily identifying. बच्चों कोई issue नहीं होगा. You will be easily identifying if there is already given the diagnosis is already given in the question, right? So that is the hypochondriasis. What would be your answer now? Why C? Why C? He's already having cancer. He's already having diagnosis in his mind. He's having already having all the investigations, right? This can be, yes, this can be a patient of Munchausen also, but Munchausen patient will be requiring medical attention. उसको एक बार रख लेंगे ना कोई, तो he will be staying there for such a long period of time, right? But this patient is having doubt. This patient is having doubt on the doctor. He did not believe the doctor. He did not believe the doctor. So history is suggesting what? Hypochondriasis, guys. Okay, okay, no problem. A man brought her wife to OPD and has complaints that she is very shy. एक बंदा अपनी बीवी को लेके आता है, बोलता है मेरी वाइफ बहुत शाई है, डोंट स्पीक मच, कम बोलती है और बहुत ही मैच्योर है, राइट, एंड काम सिंस द बिगिनिंग, जब से शादी हुई है तब से ठंडी है, ठीक है, काम है. बट लास्ट वीक ही सॉ हर फ्लर्टिंग, उसने अपनी पत्नी को फ्लर्टिंग करते हुए देखा लोगों के साथ में. एंड व्हेन ही आस्क्ड, शी सेड she could not recall any of this. She could not recall any of this. And during the fight, she started to talk like a child. Okay, childlike voice, and started crying. What is the most likely diagnosis of this particular patient? Don't worry, guys. Don't worry. I will be completing. I will be completing, don't worry. Tomorrow also we are having a session for micro and derma NLC channel. Okay, you can see. So look here. What is the disorder that we are having over here? B, bipolar. Why bipolar, guys? Bipolar, remember guys, bipolar people will be having mania and depression. Okay, bipolar का मतलब क्या होता है? Patient will be having mania. Mania मतलब क्या हो गया? Dopamine बढ़ गया. Patient will be happy all the time, right? Depression में patient will be sad all the time, right? So we are having two things. One is mania, another one is depression, right? What is happening here? What is the diagnosis that we have to make here? We are having depersonalization disorder. We are having bipolar, depression, and dissociative identity disorder. Okay, try to answer now. D, she has symptoms of depression. No, she do not have symptoms of depression. Look here guys, let me give you hint is already in the question itself. वो बंदा बोल रहे है उसकी वाइफ जो है बहुत ही शांत है स्टार्टिंग से, ज़्यादा बोलती नहीं है, हो सकता है अच्छी हो, ठीक है. सो व्हाट इज़ द थिंग दैट इज़ हैपनिंग ओवर हियर? लुक हियर. Now, when he is fighting with her wife, she is having childlike voice. Okay, childlike voice मतलब क्या हो गया? It is having multiple personality. Can you appreciate? Multiple personality. सोचने का तरीका थोड़ा सा बदलना होगा. So, what the question wants to know? Generally, these are the things that are present with her wife, right? उसने कभी नहीं देखा उसको फ्लर्ट करते हुए, बट नाउ इट इज यू मस्ट हैव सीन द मूवी अपरिचित, राइट? इन अपरिचित व्हाट इज हैपनिंग? उसमें मल्टीपल पर्सनैलिटी डिसऑर्डर, राइट? अपरिचित इज व्हाट? इट इज अ मल्टीपल पर्सनैलिटी डिसऑर्डर, राइट? नाउ इट इज मल्टीपल पर्सनैलिटी डिसऑर्डर इज नोन एज DID. तो ये बेसिकली जो DID है इसका दूसरा नाम ही मल्टीपल पर्सनैलिटी डिसऑर्डर है. ओके, इसी का दूसरा नाम ही मल्टीपल पर्सनैलिटी डिसऑर्डर है. नाउ लुक हियर, व्हाट यू नीड टू सी. हर वाइफ इज फ्लर्टिंग बट शी डोंट नो. ओके, व्हेन ही आस्क्ड शी सेड शी कुड नॉट रिकॉल एनी ऑफ दिस. उसको कुछ भी याद नहीं है. जस्ट लाइक इन द मूवी यू आर हैविंग मल्टीपल पर्सनैलिटी, यहाँ पर ये बच्ची बन गई, यहाँ पर ये फ्लर्टिंग कर रही है, बट शी डोंट नो. ओके, सो वी आर हैविंग डिफरेंट डिसऑर्डर्स. लेट्स सी वन बाय वन टाइप्स ऑफ डिसोशिएटिव डिसऑर्डर. फर्स्ट वन दैट वी आर हैविंग इज डिसोशिएटिव अमनेशिया. मतलब क्या होगा बच्चों डिसोशिएटिव अमनेशिया का? देर विल बी अमनेशिया मतलब देर विल बी सम प्रॉब्लम विद द मेमोरी, प्रॉब्लम विद द मेमोरी ऑफ द पर्सन, राइट? सो अगर बचपन में कभी तुम्हारी बहुत गंदी तरीके से पिटाई हुई हो या कोई भी ऐसा इवेंट हुआ हो, दोज पीपल लाइक some people are having some horrible events in the childhood, कुछ sexual abuse होते हैं. So those people who are having those kind of events in the childhood, वो अपने आप brain क्या करता है? What the brain will do, it will suppress it, it will dissociate it. Okay, वो लोग भूल जाते हैं, right? So any kind of stressful event, just remember any kind of stressful events in childhood, okay, they are lost selectively, they are lost. डिसोशिएटिव अमनेशिया क्यों बोला? अमनेशिया मतलब क्या हो गया? कंप्लीट मेमोरी लॉस. ओके, डिसोशिएटिव मीन्स देर इज अ स्पेसिफिक पार्ट ऑफ द मेमोरी विच इज डिसोशिएटेड. जो स्ट्रेसफुल पार्ट था दैट इज डिसोशिएटेड, दैट इज नॉन एज डिसोशिएटिव अमनेशिया. Second one is your depersonalization or derealization disorder. Remember guys, in depersonalization disorder there will be loss of self. बंदा क्या सोचता है? बंदा सोचता है खुद को बाहर रख के खुद से. ही विल बी थिंकिंग लाइक आई एम स्टैंडिंग आउटसाइड एंड आई एम लुकिंग एट द वर्ल्ड. दैट इज डीपर्सनलाइजेशन मतलब खुद से अलग होके, राइट? डी रियलाइजेशन मीन्स वॉट? ही विल बी हैविंग लॉस ऑफ एनवायरमेंट और लॉस ऑफ वर्ल्ड यू कैन से. तो ये वाले जो डी रियलाइजेशन वाले बंदे होते हैं इनको लगता है सब कुछ नकली है, एवरीथिंग इज फॉल्स. ओके, दे आर लॉस्ट फ्रॉम द वर्ल्ड. ओके, एंड डीपर्सनलाइजेशन मतलब खुद से अलग होके दूर से देख रहा है. जस्ट लाइक ए मूवी, ही इज वॉचिंग हिमसेल्फ, ही इज डूइंग थिंग्स, राइट? so that is the depersonalization and derealization disorder. Okay, what is dissociative fugue? Dissociative fugue में क्या होगा? बंदा भूल जाएगा. फॉर एग्जाम्पल यू मस्ट हैव सीन सम पीपल हु आर लाइक कोई बंदा बिहार से यहाँ आ गया सपोज एंड नाउ ही इज़ वर्किंग. व्हेन यू आस्क द पेशेंट कि तुम कौन हो, कहाँ से आए हो, फ्रॉम वेयर यू हैव कम, तो ही डोंट नो एनीथिंग. वो अपनी जगह सब कुछ छोड़ के ट्रैवल करके दूसरी जगह आ गया, राइट? ही फॉरगॉट एवरीथिंग अबाउट द पास्ट लाइफ. ओके, वो नई जगह चला गया. Lastly, we are having dissociative identity disorder. Basically it is a type of multiple personality disorders. Multiple personality disorder, okay, multiple personality disorders that, okay, समझ में आया बच्चों? सो व्हाट वुड बी योर आंसर हियर? इसकी पत्नी को क्या हो रहा है? इसकी पत्नी नॉर्मल थी, हर वाइफ इज कंप्लीटली नॉर्मल. नाउ व्हाट इज हैपनिंग? इसकी वाइफ फ्लर्ट करने लगी है लोगों के साथ में. शी हैज स्टार्टेड फ्लर्टिंग. अपार्ट फ्रॉम दैट वो बच्चे की तरह रो रही है. सो शी इज हैविंग अ different personality, right? So try to identify if there are different personality, that is known as dissociative identity disorder. Clear? Next one बच्चों. Next one is your a known alcoholic patient is presented to emergency department with the complaints of palpitation. First thing we are having is palpitation and suspiciousness. On examination, what we are finding? We are finding the patient is having tremors. Okay, pulse rate is 125 per minute, and he is oriented to time, place, and person. Okay, he is already oriented to time, place, and person. The attendant also gives a history of seizure episode. Okay, अभी patient को क्या है? Seizure आया a few minutes ago. Very very important, you need to identify the keywords. What would be the best line of management here? What would be the best line of management over here? What would be the best line of management over here? First of all, try to make the diagnosis, guys. In psychiatry, if you know the diagnosis, your treatment will be fine. Okay, so why these symptoms are there? Pulse rate is 125 per minute. That means there is tachycardia. You can observe patient is having seizures. Patient is oriented to time, place, and person, but patient is also having tremors. Okay, patient is also having tremors. What is tremors? Tremors is basically a skeletal contraction. If there is contraction in the cardiac muscle, we call it palpitation. If there is excessive contraction in the skeletal muscle, we call it tremors. And tremors are the symptoms that you will be finding in alcohol withdrawal. Now, why they are giving you history of alcoholic patient? Because we are talking about the alcohol withdrawal. And what is the drug of choice that you will be using for alcohol withdrawal, guys? That would be your benzodiazepines. Okay, that would be your benzodiazepines. Okay, so what are the things you have to remember? Can you give a rectal diazepam here? Can you give a rectal diazepam? Banda awake hai. Why you will be giving rectal diazepam? That would be uncomfortable, guys. Okay, so that would be uncomfortable, so we cannot use rectal diazepam. We need to give diazepam. Okay, and ecamprosate, that is to decrease the craving. So basically it is a anti-craving drug that we are using. So here there is nothing to do with the craving itself, and the drug of choice that we are using here is chlordiazepoxide. It is a long acting benzodiazepines. Remember guys, alcohol क्या करता है, दारू से क्या होता है? Your mind will be depressed. Okay, दारू or alcohol, whatever things you are taking, what will happen? Your mind will be depressed, right? This chlordiazepoxide, this benzodiazepines, what they will do? They will also do the same functioning, sir. It will be increasing GABA. They will be increasing GABA. और जैसे ही GABA बढ़ेगा, what will happen? Your brain will be depressed. Okay, so for alcohol withdrawal patient, we can use chlordiazepoxide. Okay, naloxone is the drug we are using for where? We are using for opioid poisoning, guys. Opioid poisoning, the drug of choice is naloxone. Okay, then we will be shifting the patient to naltrexone. Okay, then we will be shifting our patient to naltrexone. Okay, then we will be shifting our patient to naltrexone. Now see what are the symptoms that you will be finding. Okay, so very very important, guys, very very important. Based on the timeline, they will be asking you question, so try to answer here. First 6 hours after alcohol withdrawal, you cannot, for example, there is a case, let me give you a history. There is a case, उसमें क्या हुआ, एक बेटे ने अपने पिता को रूम के अंदर बंद कर दिया फॉर 3 days. आफ्टर 3 days when he entered the room, his father is dead. Why? Because look here, why his father is dead? Because of he is very much dependent on the alcohol. Look here, what are the symptoms he must be having? For first 6 hours the patient will be having anxiety, insomnia, and tremors. For first 6 hours the patient will be having these tremors, anxiety, and insomnia. Okay, for next 12 to 24 hours the patient will be having auditory and visual hallucinations. Okay, and these are known as hallucinosis symptoms. These are known as hallucinosis symptoms. Okay, next 24 to 48 hours the patient will be having seizures. In our patient we are having what? Seizures. Okay, so there is withdrawal symptoms. Patient will be having shaking, patient will be having heavy sweating, along with that patient will be having seizures. Okay, in the next 2 to 3 days or 48 to 72 hours patient will be having a thing that is known as delirium tremens, and this is very dangerous things, guys. This is a very dangerous things. After that what will happen? If not treated, the patient will die. The patient will be having illusions, patient will be having racing heartbeat, high blood pressure, continued respiration, okay, and high fever, and ultimately the patient will die after 3 days. Okay, so these are the symptoms, these are the symptoms that you have to remember. Okay, first one that you have to remember, first symptom that would be coming in the patient will be tremors. So whenever in your OPD the patient will be coming to you, patient is having tremors, what you will see, the patient has not taken alcohol in the last 6 hours. Okay, second thing, patient is having some kind of hallucination for the next day. Next day patient will be having seizures, and ultimately if not treated the patient will be having delirium. So what we can do, we can give benzodiazepine. Benzodiazepine से क्या होगा? Chlordiazepine oxide. What it will do? Sir, it will be depressing the brain, so these symptoms will not come. Okay, तो ऐसे करके हम लोग एल्कोहल डिपेंडेंस को ट्रीट करेंगे. मतलब जो पेशेंट एल्कोहलिक है उनको ऐसे करके छुड़ाएंगे हम लोग, उनको किस पे शिफ्ट कर देंगे? लॉन्ग एक्टिंग बेंजोडाइजेपिन, दैट इज chlordiazepine oxide. Okay, chlordiazepine oxide. Understood, guys? So this is the thing. Okay, now try to solve this one. A 32-year-old patient is afraid of using lift. The patient is having fear of lift. Being in crowded places, traveling alone, what would be the best management of this particular patient? First of all, try to make the diagnosis again. What is the diagnosis? What is your diagnosis? The patient is having fear, right? Fear means patient is having some kind of phobia. Try to answer what kind of phobia the patient is having and how you will treat this particular patient. First of all, what kind of phobia the patient will be having? Patient will be having what kind of phobia? This is known as agoraphobia. This is known as agoraphobia. Okay, patient is having fear of escape. Okay, fear of escape will be there. How you will treat phobias? For treatment of phobias, you will be giving pharmacotherapy along with the behavioral therapy. Remember, guys, behavioral therapy is the therapy we will be using for any kind of specific phobias. Phobias के लिए हम लोग क्या देंगे? BT देंगे, right? Crowded places, right? Next one, a 23-year-old male patient was on treatment of depression. The patient is on the treatment of depression and he has consumed a large number of tricyclic antidepressant pills. Okay, TCA pills खा लिया. The patient is having depression and the depressive episode, during the depressive episode, and he was brought to the emergency room with hypotension. What are the symptoms we are having? The patient is having hypotension, the patient is having altered sensorium, the patient EEG will be showing, ECG will be there, ECG will be showing wide QRS complex. Okay, wide QRS complex will be there. What is the best step in treatment of this particular patient? Hemodialysis, C. Try to answer. So basically, first of all, make the diagnosis again. What is your diagnosis, guys? Look here, these are all the symptoms that are coming after taking a drug. These are your tricyclic antidepressant. And remember, guys, I have told you tricyclic antidepressants are cardiotoxic drugs. They are cardiotoxic drugs. So the patient is having tricyclic antidepressant toxicity. And one symptom that you have to remember about TCA toxicity, which is, that is your metabolic acidosis. Metabolic acidosis is caused by tricyclic antidepressant toxicity, और उसकी वजह से क्या होगा? Symptoms आएंगे, right? So how we will particularly treat this particular situation? We will be giving what? Yes, Sahana, we will be giving soda carb. We will be giving soda bicarb, and this is the question they have multiple times asked. They will be giving soda bicarb IV. Okay, that is the drug of choice here, right? Generally, look here, guys, SSRI we are using for mild depression. If there is mild depression, mild to moderate depression, we are using SSRI. For the patients of severe depression, we are using SNRI. Okay, selective serotonin norepinephrine reuptake inhibitors. Okay, that is your SNRI. So these are the drugs that we will be using. Now try to solve this one. Priya, a 24-year-old female, wants to be the center of attention and exaggerates everything. She exaggerates everything, making it sound very important, and then it really is. And she behaves in an extrovert manner. She is an extrovert person. Sometimes she uses physical appearances to draw the attention of the next person, or which of the following can be best suited in this particular category. So basically this type of person nowadays you will be finding in the social media, right? This is the thing that is happening. They want to become the center of attention. They require the attention, right? They are extrovert people. So what kind of thing that you have to see over here? Are the people happy with themselves? CC, that is histrionic. PD is personality disorder. Okay, so can first of all tell me, personality disorders are egosyntonic or ego dystonic? Personality disorders are egosyntonic or ego dystonic? Egosyntonic मतलब क्या होता है बच्चों? Agreeable to self, खुद को अच्छा लगने वाला. Okay, so are these type of people are happy with themselves? Are they happy? Are they happy with themselves? Yes, these type of people are happy with themselves. Okay, so this is the ego syntonic thing. This is the ego syntonic. Okay, OCD, remember I told you about the OCDs are ego dystonic, whereas this particular thing is ego syntonic. Okay, so answer here will be borderline personality disorder. Okay, answer here will be B. Guys. Okay, let me teach you how. Okay, so we are having types of personality disorders. We are having three clusters. Cluster A will be there, cluster B will be there, cluster C will be there. What is the thing that you have to remember? Cluster A will be having these people will be having old and eccentric thinking. Will be there. Okay, cluster B will be, these are the dramatic people. These are your dramatic people, erratic people. Okay, and cluster C will be, these are the anxious people. They are always fearful, guys. Bache. Okay, so these are the three things that you have to remember. Cluster A will be old and eccentric pattern of behavior you will be finding. Cluster B will be having, just a moment. Cluster B will be having dramatic and erratic response. Cluster C will be anxious people. What are the things that are coming here? First one, cluster A will be having paranoid personality disorder. What is paranoid? They are always afraid. इनको हमेशा शक होता रहेगा. They are having paranoia. Second one is your schizoid. Third one is your schizotypal. Okay, here in cluster B we are having antisocial persons, we are having histrionic, we are having narcissistic, we are having emotionally unstable. Okay, cluster C will be, they are avoidant, they are obsessive compulsive disorders, OCD, and we are also having dependent personality disorders. These are the people who are always dependent on other people. Let's see one by one what are the different things you have to remember about them. The first one that we are having is paranoid people. They are always suspicious. How you will remember these things? Just try to remember whatever people, simply whenever you will meet a new person, what you will do, you will try to attach that particular person to the person that you already know. अगर किसी भी नए इंसान से मिलोगे तो क्या करोगे, यार ये उसके जैसा लग रहा है, right? So this is how you can remember this. You have to attach these personality disorder to your specific friends. किसी ना किसी को पकड़ा दो, right? तो first thing, some people are always paranoid. They are coming under cluster A. इनको क्या होता है, पेटीएम पे भी ये लोग क्या करेंगे, स्क्रीनशॉट भेजेंगे, इस नंबर नहीं देंगे क्योंकि इनके अकाउंट में से कोई पैसे निकाल लेगा. दीज आर द टाइप ऑफ पीपल विच आर पैरानोइड पीपल. ओके, सेकंड इज योर स्किजोइड पीपल आर सोशली डिटैच्ड पीपल. ये लोग ज़्यादा बाहर जाना ही पसंद नहीं करते. दे आर नॉट गोइंग आउटसाइड एंड दे आर वेरी लेस इमोशनली एक्सप्रेसिव, ओके। ये लोग ना ज़्यादा किसी को बताते हैं, दे आर बेसिकली स्किजोइड टाइप ऑफ पीपल. What is the schizotypal people? They are having socially discomfort. ये लोग जाना तो चाहते हैं, but they are not at all good in making friends and all those things, okay. So they are socially discomforted people. We are also having cognitive distortions. They are having cognitive distortions, okay. So paranoid, schizoid and schizotypal, because they are having old pattern of behavior. ये लोग थोड़े पुराने विचारों के होते हैं. That is why they are not having good much of a friend, right? They want to go out, but they don't generally go out. This is how you will differentiate. Schizoid में क्या होगा, वो जाना ही नहीं चाहते. Schizotypal जाना चाहते हैं पर कुछ कर नहीं पाते, right? Next we are having is cluster B. Cluster B will be dramatic kind of people. Dramatic people, first one is your antisocial. Antisocial, they don't have mercy. First thing, they don't have mercy. They will violate the right. अगर कहीं पर कुछ दंगे हो रहे हैं, फसाद हो रहे हैं, तो these are because of this type of antisocial people, okay. Second we are having borderline. They are having unstable relationships, और ये फिर से दोबारा रिलेशनशिप में आ जाएंगे. एंड दे आर हैविंग इम्पल्सिव बिहेवियर. ये बहुत ज़्यादा प्यार करेंगे दूसरे वाले को, राइट. सो इनके लिए जीने मरने वाली बात हो जाती है. तो दीज आर योर बॉर्डर पर्सनैलिटी. दे आर हैविंग अनस्टेबल रिलेशनशिप्स और इम्पल्सिव लोग होते हैं, ये इम्पल्स में डिसीजन लेंगे, राइट. Next we have seen histrionic. That was our answer. These are the people which are having excessive attention seeking behavior. You must have seen these people in your Instagram, right? इनको attention चाहिए होती है हमेशा, right? Next one is your narcissistic people. ये भगवान समझते हैं खुद को. They are having the thinking that the thinking of grandiosity, okay, and they do not have a much of empathy. इनके अंदर ज़्यादा empathy नहीं होता, इनको खुद ही भगवान लगते हैं. So that is the narcissistic personality, okay. Cluster C will be first one. They are basically anxious people. They are fearful people. ये हमेशा डरे डरे से रहते हैं, okay. So first one we are having is avoidant. They will try to avoid everything, okay. So we are having hypersensitivity to negative evaluation, okay. So they are basically, इनको ऐसा लगता है पीपल विल ट्राई टू जज देम, ओके, और उसके बेसिस पे दे विल नॉट गो आउटसाइड, ओके. दे विल अवॉइड मल्टीपल थिंग्स, ओके. दे आर अवॉइडेंट पीपल. नेक्स्ट वन इज डिपेंडेंट. डिपेंडेंट लोग, इनको सब चीज़ों के लिए किसी ना किसी के ऊपर डिपेंड होना होता है. इवन इफ दे आर बाइंग समथिंग, दे विल बी डिपेंडेंट ऑन other people. These are the dependent type of personality. And last one we are having obsessive compulsive personality. These people will look for perfection. They will be looking for perfection and control, okay. So these are the important things that we have to remember about these three types of personality disorder. Now you will be answering, okay. Excessive attention seeking behavior. In the question they have given you that the patient is the person is wants to become the center of attention. Then your answer will be borderline personality disorder. Your answer will be your answer will be histrionic, guys. Histrionic personality disorder, okay. That would be your histrionic personality disorder. बॉर्डरलाइन कब होता है, जब द पेशेंट इज हैविंग अनस्टेबल रिलेशनशिप, वो वापस से दूसरे रिलेशनशिप में आता है, हाथ काट लेता है. दीज आर द पीपल विच आर बॉर्डरलाइन, ओके. दीज आर इंपॉर्टेंट. क्वेश्चन हैज बीन आस्क्ड फ्रॉम दिस, ओके. ऑल ऑफ द फॉलोइंग आर फीचर्स ऑफ pseudo hallucination. All of the following are features of pseudo hallucination. All of the following are features of pseudo hallucination except, first of all, hallucination. What is hallucination? Hallucination, remember guys, hallucination क्या होता है? Hallucination is basically it is a type of perception. It is a type of perception. Is it a true perception or is it a false perception? It is a false perception of real object or no object. There will be no object and it is a false perception in absence of any object, okay. They will be vivid as real. They will be vivid as real. That means, for example, I am sitting in front of you, you can see me. Those people who are hallucinating, they can also see me like that. Even if I'm not present, they can see me, right? So that is the false perception and they are vivid, okay. What will happen in the pseudo hallucination? What will happen in the pseudo hallucination? They are also present, but the important thing, they will be present in outer objective space or inner subjective space. Very good, Puneet. So that would be presenting in inner subjective space, okay. They will be presenting in inner subjective space. inner subjective space. They are not in the outer objective space. outer objective मतलब क्या है, environment के अंदर नहीं मिलेगा, वो अंदर ही अंदर सोचेगा, ठीक है. So that is the hallucination. They occur without stimulus. Yes, it is a true statement. Okay, they are vivid. Yes, it is also a true statement, but this one is the false statement. And are they under willful control? No, they are not under willful control, so it is also a true statement. Okay, so answer here will be C, guys. Answer here will be C, right? Clear hai? Next one. A 25-year-old male patient is having some sort of disorder characterized by, क्या characterized है? First thing, the patient is having, after killing his victim, he licks the wound. वो killing के बाद में he licks the wound. He drinks the blood and eats the flesh to gain the sexual pleasure. Very important, sexual pleasure. Which of the following best explain this? Which of the following will best explain this? Try to answer. Is it a clismaphilia, C, fetishism, or is it a necrophilia? Try to answer, guys. E, necrophilia. हम सभी एक ही नाव के ऊपर बैठे हुए हैं और वो पूरी नाव डूबने वाली है. द आंसर विल बी डी, गाइस. आंसर विल बी डी. आंसर विल बी डी, गाइस. लुक हियर, व्हाई. सारा एक साथ डूबेंगे, राइट? सो necrophilia means what? Necrophilia, the person is having sex with, the person is having sex with the dead body. If the person is having sex with the dead body, that is why they have given you this particular word. This is the exam question, right? That is why they have given you this particular word, right? If the patient is having sex with the dead body, that is necrophilia. What is clismaphilia? Clismaphilia क्या होता है बच्चों? What is the clismaphilia? If the person is using enema for sexual gratification, enema for sexual gratification, if the person is using enema for sexual gratification, that is your clismaphilia. fetishism का मतलब क्या होता है? FMT फोरेंसिक में भी आता है, बताओ. fetishism, when people are using, when patient or people, person, whatever, is using inanimate object. What is that inanimate object? That means, for example, the patient is using the undergarments of the opposite sex. For example, person is using the undergarments of female, right? So that is the fetishism. Okay. And necrophagia, look here, guys, what he is doing. He's killing. Why he's killing? Why he's killing, Puneet? Not because he is hungry, but he will be getting some kind of satisfaction, after killing. Okay, he will be getting that some kind of satisfaction, and that is why it is known as necrophagia. Eating dead body. Eating dead body will lead to release of some kind of substances in his body, right? That would be giving him the sexual gratification. Okay, फालतू तो नहीं मारेगा कोई, right? So that is the necrophagia. Which is okay. Now let's see what are the sexual disorders that we are having. Okay, so we are having first, look here, we are having sexual dysfunctional symptoms. What are these? Just try to look one by one. We are having sexual desire disorders like hypoactive desire, sexual aversion disorders. We are also having arousal disorders. Okay, in males we are having erectile dysfunction. Okay, erectile dysfunction I have already told you. Female is also having such type of arousal. मतलब क्या हो रहा है? Female activate नहीं पा रही, right? So these are the disorders. We are also having orgasmic disorders, female orgasmic disorders. In males we are having a disease again, that is premature ejaculation. I have already told you the drugs that we will be using for premature ejaculation. Okay, Patient female can have sexual pain disorder also. These are known as dyspareunia or vaginismus. Okay, the patient is having, the female is having problem or pain while having sex. Okay, so these are the important one that you have to remember, and these are all your psychogenic disorders. Psychogenic, okay, psychogenic disorders, and psychogenic disorders we can treat with drugs. Okay, we can treat with therapies as well, we can treat with drugs as well. Okay, second thing, we are having organic etiology. Organic matlab kya hai? Something is dysfunction, right? The patient can have substances abuse. Because of substances abuse, the patient may have sexual dysfunction. Okay, sexual dysfunction due to general medical conditions like diabetes. In diabetic patients there will be problem, right? Next, sexual dysfunction due to combined factors can also be there. Okay, that is your organic etiology. Next, we are having lack of emotional satisfaction from sexual behavior. Look here, the important one is you have to remember gender identity disorder. Gender identity disorders or dysphorias. Look here, we are having dysphorias, GAD or dysphorias. Nowadays you are seeing that there is a male who is trapped inside the body of a female. That is basically a gender identity disorder. Okay, next, homosexuality is there. Okay, sexual identity difficulties disorder. Let's see what are the paraphilias. Paraphilias are also sexual disorders. Okay, we are having pedophilia. Pedophilia matlab kya hoga? The person is loving to child. Okay, child is there. Voyeurism. Can anyone tell me what is the meaning of voyeurism? Voyeurism, the person is getting sexual gratification by looking at the other person. Okay, voyeurism मतलब किसी को कपड़े चेंज करते हुए देखना, किसी को नहाते हुए देखना, that would be your voyeurism. किसी को सेक्स करते हुए देखना. These are all your paraphilias. This is your voyeurism. What is exhibitionism? इसका मतलब क्या होगा? This is to see and this is to show, right? दिखाना, that is your exhibitionism, right? Rape, it is a type of sadism. Sadism में क्या होगा? The person wants to give the pain to the another person, right? And rape will be a type of sadism. Okay, frotteurism, the meaning of frotteurism will be frotteurism का मतलब क्या होता है? Frotteurism, try to answer what is frotteurism. Okay, we are having masochism. एक होता है सैडिज्म, एक होता है मैसोचिज्म. सैडिज्म मतलब क्या होगा? बंदा जो भी है वो he will be giving pain to the person. Okay, he will be giving pain to the person and getting the sexual gratification. उसको अच्छा लगेगा दूसरे को दुख देके, right? Just like the NMC, right? What they are doing, they are just changing the dates of the exam and they are getting the sadistic pleasure, right? उनको अच्छा लग रहा है, right? Right, just like that. Okay, this is just an example. Okay, masochism means what? Those people जिनको दर्द लेने में मजा आता है. Those people, मैसोचिज्म का मतलब क्या हो गया? जिनको दर्द लेने में मजा आता है. There are some people who wants to have pain. Okay, so that is your masochism. They love suffering. Transvestism, ये क्या होता है? ट्रांसवेस्टिज्म, लड़की के कपड़े पहनना या लड़के के कपड़े पहनना. That is your transvestism. Okay, fetishism we have already seen, right? So these are the different paraphilias. Have you answered about frotteurism? What is frotteurism? Frotteurism का मतलब क्या होता है? When you are rubbing your organs, maybe your organs, or when you are rubbing the organs of another person, right? When you are touching or rubbing organ, that is frotteurism. Okay, उसको क्या बोलते हैं? Frotteurism बोलते हैं. We are not masochism. We are not masochism. We don't want masochism. We just want to have a normal life. Okay, so they need to understand. They should stop getting sadistic pleasure from us, right? So this is the thing. Okay, let's come back to the question, guys. A 8-year-old child is restless. The child is restless in the class and keeps roaming and disturbing other students. ये वो वाले बच्चे जो दूसरों को परेशान करते हैं. His teacher complains that he is very inattentive. इसको कोई लेना देना नहीं है क्लास में. And does not obey any orders. ये किसी की बात भी नहीं मानता. Which of the following is not true about the diagnosis? First of all, what is the diagnosis that you are getting? क्या लगता है तुम्हें क्या होगा? What do you think? What is the diagnosis? एक बच्चा है जो 8 साल का है, देर इज अ बॉय. एज इज इंपॉर्टेंट, रिमेंबर गाइज. ऐसी चीज़ें जो तुम लोग छोड़ दोगे उससे से क्वेश्चन बन जाएगा. जस्ट लाइक वी हैव सीन इन द क्वेश्चन, अगर रिकरेंट दिया हुआ है, इम्पेंडिंग डूम दिया हुआ है, योर आंसर विल बी चेंज्ड. ओके, पैनिक अटैक, मोस्ट ऑफ द पीपल विल बी मार्किंग पैनिक अटैक. व्हाट वुड बी योर यूटिलाइजेशन ऑफ दिस क्लास, मतलब तुम्हारा क्या फ़ायदा हुआ? तुम्हें ये पता चला कि नहीं ये नहीं होगा, ऐसे करने, राइट? सो दैट इज़ व्हाट इज़ इंपॉर्टेंट. डायग्नोसिस विल बी वेरी गुड. पुनीत, डायग्नोसिस सहाना, दैट वुड बी योर ADHD. ADHD का मतलब क्या होता है? अटेंशन डेफिसिट हाइपर एक्टिविटी डिसऑर्डर. अटेंशन डेफिसिट हाइपर एक्टिविटी डिसऑर्डर गाइज. ओके, सो वॉट वी नीड टू डू इन दिस टाइप ऑफ चिल्ड्रंस, ये जो बच्चे होते हैं इनमें क्या करना होता है? वी नीड टू इवेलुएट द चाइल्ड फॉर लर्निंग एंड लैंग्वेज डिसऑर्डर. यस, दैट इज अ ट्रू स्टेटमेंट. They want to know which one is not true, which one is not true. Okay, so first one is a true statement. Second thing, first line of management. Remember guys, first line of management ADHD में भी क्या होगा? We need to give the patient, बच्चे को क्या देना है? Behavioral therapy देना है. That would be true again. Okay, the child will develop aggressive and destructive behavior. No, it is not predict. We are not like ज्योतिष नहीं है बता देंगे फ्यूचर का. देर इज सम चांसेस बट दिस इज नॉट गोइंग टू हैपन, राइट? अगर हम उसका अच्छे से ट्रीटमेंट करेंगे एट दिस पॉइंट ऑफ टाइम, व्हाट विल हैपन? द पेशेंट विल बी नॉर्मल. ओके, एंड मिथाइल फेनिडेट इज द ड्रग ऑफ चॉइस we can use for treatment. Yes, definitely we can use the methylphenidate. That is the drug of choice we will be using for ADHD. Okay, so this third statement is the false statement and this will be the answer over here, right? This one will be the answer over here. मोर और लेस वी आर ऑल्सो दिस टाइप ऑफ चाइल्ड इन द चाइल्डहुड, राइट? हम भी ऐसे ही थे. तो क्या हम अग्रेसिव और डिस्ट्रक्टिव बिहेवियर वाले हैं? नहीं है. ओके, इट डिपेंड्स ऑन योर एजुकेशन, इट्स डिपेंड्स ऑन योर बिहेवियरल थेरेपी. ओके, एंड ऑन योर एनवायरनमेंट, वो चीज़ें ठीक हो जाती है, राइट? सो नेक्स्ट क्वेश्चन. अ 23-year-old male patient presented to OPD with excessive sleeping in the daytime. Excessive sleeping in the daytime. He falls asleep when driving, गाड़ी चलाते time for long distance, and also during laughing, हंसते हंसते सो जाता है. He also had sometimes hearing of voices while going to the sleep. What is the most likely diagnosis you will be finding here? What do you think, guys? This cases. What do you think, guys? This cases. What is your diagnosis first? What do you diagnose? Then you will be treating. Okay. So this patient is having what? क्या हो सकता है इसको? The patient is having excessive sleeping in the daytime. Try to look for the keywords. Excessive sleeping in the daytime. दिन में ज़्यादा सो रहा है, गाड़ी चलाते टाइम सो जाता है, हंसते हंसते सो जाता है. He also had sometimes hearing of voices. Hearing of voices. Voices मतलब don't just directly jump for the answer, guys. Please try to answer. What is your diagnosis? पहले diagnosis बताओ. Narcolepsy. So basically he is having some kind of sleep attacks. Very good, Puneet. He is having some kind of sleep attack. In sleep attack, in narcolepsy, what will happen? Look here, guys. There will be decrease in the latency of REM sleep. लेटेंसी कम होगी. लेटेंसी मतलब क्या होता है? लेटेंसी मतलब सिंपली होता है जैसे तुम सोने गए और तुम्हें 2 घंटे में नींद आ रही है या 4 घंटे में नींद आ रही है, तो वट एवर ड्रग्स दैट यू आर टेकिंग, वट एवर ड्रग्स, बेंजोडाइजेपिन्स, योर जोल्पिडेम, जेड ड्रग्स, वट एवर ड्रग्स दैट यू आर टेकिंग, बेसिकली वट दे आर डूइंग, दे आर जेड ड्रग्स, वट दे विल डू, दे विल डिक्रीज द लेटेंसी. अभी तुम्हें 2 घंटे पड़े रहने के बाद में नींद आ रही थी. नाउ वट विल हैपन? द लेटेंसी विल बी डिक्रीज. अभी तुम्हें आधे घंटे में नींद आ जाएगी, राइट? सो दैट इज हाउ वी आर यूटिलाइजिंग. And in this disease what will happen? The latency of REM sleep will be decreased. Okay, तो नार्कोलेप्सी वाले पेशेंट में क्या होगा? लेटेंसी ऑफ REM sleep will be decreased, right? क्या क्या चीज़ें मिलेगी इसके अंदर? You can remember the mnemonic, that is chess. You will be having कैटाप्लेक्सी. कैटाप्लेक्सी मतलब क्या होगा? ये बंदा खड़ा खड़ा भी सो सकता है, सीधा गिर जाएगा. दैट इज कैटाप्लेक्सी. एक चीज और होती है कैटालेप्सी. व्हाट इज कैटालेप्सी? ट्राई टू आंसर. द पेशेंट विल बी हैविंग हेलुसिनेशन. द पेशेंट विल बी हैविंग हेलुसिनेशन. E for excessive day sleep. Just remember this. Excessive day sleep will be there. Okay. Apart from that, patient can have sleep paralysis. Sleep paralysis क्या होता है? What is sleep paralysis? कभी कभी हम लोग सोए होते हैं एंड वी फील लाइक समथिंग इज सिटिंग ऑन अस, राइट, वी कैन नॉट वेक अप, राइट, दैट इज नोन एज स्लीप पैरालिसिस। कभी कभी ऐसा लगता है कि कोई तुम्हें दबा रहा है, कोई तुम्हें उठने नहीं दे रहा, तुम उठ चुके हो बट यू आर नॉट एबल टू वेक अप फ्रॉम द बेड, दैट इज स्लीप पैरालिसिस, ओके। एज फॉर sleep disruption will be there. So that is the, these are the symptoms you will be finding in this particular patient, okay. So this is a case of narcolepsy, this is a case of narcolepsy. And this particular thing, hearing of voices, I have told you, it is a auditory hallucination while going to sleep. So while going to sleep is known as hypnagogic, hypnagogic hallucination, hypnagogic hallucination, auditory hallucination, okay. And we are also having hypnopompic hallucination. We are also having one more thing is there, that is hypnopompic hallucination. Yes, we are not able to scream, right, हम लोग आवाज नहीं निकाल पाते. These are the things you will be finding in sleep paralysis, okay. समझ में आ गया. सो वी आर हैविंग हिप्नोगोगिक हेलुसिनेशन, वी आर ऑल्सो हैविंग हिप्नोपॉम्पिक हेलुसिनेशन. हिप्नोगोगिक मतलब वाइल गोइंग टू स्लीप जो हेलुसिनेशन हो रहा है. जस्ट रिमेंबर, गोगिक से याद रखो, गो मतलब होता है जाना, सो दैट वुड बी वाइल गोइंग टू स्लीप, ओके. एंड हिप्नोपॉम्पिक यू विल बी फाइंडिंग ऑन वेकिंग अप, जब आप मॉर्निंग में उठते हो देन यू विल बी फाइंडिंग आफ्टर वेकिंग अप. In the question, if they write you after waking up the patient is hearing some kind of voices, okay, the patient is watching some kind of things, okay, clear things, vivid things, okay, that would be your hypnopompic hallucination, okay. Two things clear, hypnagogic hallucination, hypnopompic hallucination, both of them can be associated with narcolepsy. Narcolepsy, the drug of choice for narcolepsy, guys, what is the drug of choice that you will be using, okay. Till then, depression you already know, insomnia you already know, patient is not able to sleep, and somnolence is basically excessive feeling of sleep, feeling of sleep. दिन में क्या हुआ, क्लास चल रही थी, क्लास के बाद में लंच करने के बहुत सारा खाना खा लिया, व्हाट विल हैपन, योर पैरासिम्पैथेटिक नर्वस सिस्टम विल गेट एक्टिवेटेड एंड यू विल बी हैविंग सोमनोलेंस, यानी क्या लगेगा, बस सो जाओ, ऐसे पढ़ते पढ़ते सो जाते हो, राइट. सो दैट इज द थिंग, दैट इज सोमनोलेंस, ओके. नार्कोलेप्सी मतलब क्या हो गया, पेशेंट सो गया. सो ट्राई टू आंसर, व्हाट इज द ड्रग ऑफ चॉइस दैट वी विल बी यूजिंग for narcolepsy. The drug of choice will be modafinil, bachcho. What is the drug of choice that we are using? Modafinil. Modafinil is the drug that we are using for narcolepsy patient. Very good, Puneet. Okay, next thing. A 30-year-old female patient presented with episodes of mania. She is having mania, she is having hypomania and depression in the last 1 year, with complete recovery in between the episodes. Okay, which of the following can be used to treat this particular situation? How you will treat this particular situation? Before treatment, guys, tell me what is the diagnosis. These are the symptoms: mania, hypomania, depression. Okay, mania is there, hypomania is there, depression is there, and there is time period, which is episodic disease is there, okay. So which of the following can be used to treat this particular patient? First of all, before treating the particular patient, try to answer what is your diagnosis, what do you made the diagnosis. यहाँ पर diagnosis क्या है? Very good guys. The diagnosis is bipolar disorder. This is a bipolar disorder. Remember, if there are periods of mania, hypomania, मतलब bipolar में क्या होगा, either you will be having mania plus depression or either you will be having hypomania or mania plus depression. मतलब दोनों चीज़ें होंगी, mania भी होगा, depression भी होगा, right. If both the poles are present, that is known as bipolar disorder. That is known as bipolar disorder. In acute mania cases, how you will treat this particular patient? In acute mania cases, guys, in acute mania cases, you will be giving drugs. What the drugs you will be using? You will be using antipsychotic. You will be using antipsychotic. You can also use, in mania patients, you can also use benzodiazepines. Along with that, the drug that you will be using is your lithium. Lithium. And remember, lithium is a teratogenic drug, as well as it will be having a narrow therapeutic index. What is therapeutic index? For example, we are using paracetamol. हम लोग paracetamol खाते, paracetamol 4 गोली खा लो, 5 खा लो, nothing will happen. But if you have this lithium will be having डोज डिपेंडेंट साइड इफेक्ट्स, ओके, इनको अपन ज़्यादा अमाउंट में नहीं ले सकते हैं. दीज आर द ड्रग्स विच वी कैन नॉट टेक इन मोर अमाउंट, दैट इज नॉन एज these are having narrow therapeutic index, okay, narrow therapeutic index. So lithium will be having narrow therapeutic index, and we need to check for the levels. What are the normal levels that we need to maintain over here? That is 0.8 to 1.2 milliequivalent per liter for the cases of acute mania. Acute mania में 0.8 से 1.2 तक जा सकते हैं, right? But in the cases of maintenance, in maintenance the dose will be different. Just remember, let me write it here. Lithium in maintenance cases you will be going from 0.5 to 0.8 ml milliequivalent per liter, okay. So that is the dose you will be using for maintenance, that is the dose you will be using for maintenance, okay. And this is the drug that you will be using. लिथियम के साइड इफेक्ट के ऊपर क्वेश्चन आता है. द क्वेश्चन दे विल बी आस्किंग यू व्हाट आर द साइड इफेक्ट्स ऑफ लिथियम. यू कैन रिमेंबर द साइड इफेक्ट्स ऑफ लिथियम विद द लिथियम itself. So it will be having elevated levels of what? It will be causing leukocytosis. First one, it will be causing leukocytosis. It will be increasing the levels of WBC. Second thing, it will be I for increasing the urination, guys. It will be increasing the urination, okay. Third thing, it will be having it will be increasing your thirst, and it will be causing tremors, okay. It will be activating your thirst center. Because of that you will be having polydipsia, you will be having polydipsia, okay. Then it will be having hypothyroidism. I4, it will be causing some interaction with other drugs like diuretics you can take, okay. It will be having upset of GI, it will be having muscle weakness and skin effects, like it will be leading to psoriasis and acne also, right? So these are the important things. Yes, it will be causing abstinence anomaly as well, right? So these are the important side effects. Those people who are using lithium, there should be important side effects that you should be using, remembering, okay. We cannot give this particular drug in pregnancy because it is a teratogenic drug, because it is a teratogenic drug, it is a teratogenic drug, guys, okay. ये कैसी drug होती है? It is a teratogenic drug. Now try to solve this question. A 24-year-old male patient is sleeping in NREM sleep. Which of the following can be a feature of this NREM sleep? क्या मिल सकता है? Which of the following feature of this particular NREM sleep? Try to answer, guys. एक पेशेंट है, वो NREM sleep में. Just tell me what are the features of NREM sleep. This is your last year question in your exam. Try to answer. What is the thing that you will be answering here? I'm waiting for your response. All of the following are the features of REM apart from what? NREM में क्या मिलेगा? नहीं पता? Yes, I'm getting some responses. Okay, look here. First thing, tell me, where do you see the dreams? Dreams कौन सी sleep में आते हैं? Sleep paralysis. Where do you see the dreams? Dreams are coming in which phase of your sleep? Very good, Ritvik. That is, yes, I'm getting the right answer. That is bruxism or teeth grinding. Look here, guys. Look here. Very important things. We are having two phases of sleep. One is REM. Another one is NREM. NREM मतलब non rapid eye movement. NREM का मतलब क्या हो गया? Non rapid eye movement. REM will be rapid eye movement, okay. REM, just remember, REM को remember कर दो, okay. So you will be seeing dreams in which phase of the sleep? You will be seeing dreams in which phase of the sleep? NREM में आते हैं सपने, REM में आते हैं, या कौन से में आते हैं? Dreams are coming in which phase of the sleep? Try to answer. Waiting for your response. Try to answer, guys. The dreams are coming in which phase of the sleep? Is it NREM sleep or is it REM sleep? What do you think? Remember guys, dreams are coming in both the sleeps. We are having dreams in the REM, we are having dreams in the NREM as well. दोनों में सपने आएंगे, but the important thing is you will be remembering those dreams. REM dreams will be remembered, those dreams will be remembered. Okay, those dreams will be remembered. For example, one day you just wake up in the night, तुम एक बार खड़े होते हो and you will be thinking like this is the worst nightmare of my life. You say now, you always say like sir this is the worst nightmare of my life, तुम्हें लगेगा 149. Okay, so that is the worst nightmare of your life, right? So that is coming in the REM. एक और चीज़ होती है in REM also you will be having sleep, you will be having dreams. पर इसमें क्या होता है, the patient is not able to remember because NREM is non-remember. You can remember like that, non-rememberable. Okay, so sometimes the boy or the girl is having a dream and they will be like, I had a very bad dream, but when you try to ask what is that dream, the patient is not able to tell. Okay, the patient is not able to tell what is that dream, what is the content of that dream. Okay, तो बच्चा बता नहीं पाएगा. Generally, you know what you guys are doing in the morning itself, you are having dream and तुम लोग क्या चाहते हो वहीं से कंटिन्यू हो जाए, राइट? सुबह कोई ड्रीम आ रहा था वो टूट गया. नाउ व्हाट यू वांट, you will sleep more, 1 more hour to just continue that dream. Is that happening, right? Is that happening with you? So this is the thing that we are having. सपने दोनों नींदों में आते हैं, NREM में भी आता है, REM में भी आता है. Those dreams which we are having in NREM, they are known as night terrors. Night terrors, इनको क्या बोलते हैं? Night terrors. That means the patient, बच्चा अपना खड़ा हुआ and he will be telling or she will be telling that I had a very bad dream, but when you ask the content of the dream, she don't remember anything. उसको नहीं पता क्या था सपना, बस गंदा सपना था. So that is in the NREM sleep. That is in the NREM sleep. Okay, in REM sleep, whatever dreams you are having, you will be remembering them and they are your nightmares. They are your nightmares. Okay, second thing, REM में I have already told you there will be decrease in the latency of REM. REM की latency कम हो गया, what will happen? You will be having REM sleep in narcolepsy. So try to answer which one is the odd one out. Which one is the odd one out? You will be having nightmares, you will be having narcolepsy, and you will be having sleep paralysis also. Sleep paralysis, you will be remembering. Those people who are having sleep paralysis 1 or twice in your lifetime, you will be remembering that thing for the rest of your life. You will be like, there was some ghost, कोई भूत मेरे ऊपर आके बैठ गया था. आई एम नॉट इवन एबल टू क्राई, आई एम नॉट इवन एबल टू शाउट. मेरा दोस्त पास में सो रहा था बट आई वॉज नॉट एबल टू वेक हिम अप. मैं हनुमान चालीसा बोल रहा था, वट एवर थिंग्स आई एम डूइंग बट स्टिल नथिंग इज हैपनिंग, राइट? सो दिस इज द स्लीप पैरालिसिस. ऑल ऑफ देम आर फीचर ऑफ REM sleep. All of them are feature of REM sleep. And this is the important question they will ask you. So odd one out will be teeth grinding. Teeth grinding also known as bruxism. This is also known as bruxism or teeth grinding. Okay, so this is the feature of NREM sleep. This is the feature of NREM sleep. Let's see what other things will be there. Sleepwalking. Sleepwalking is known as somnambulism. अभी कुछ लोग होते हैं जो घूमते घूमते पड़ोसी के घर में चले जाएंगे, राइट? सो दिस इज योर somnambulism and they'll be like we don't know how we have reached here, right? So that is the sleep walking. Okay, sleep talking, some people are talking. Those of you who are living in hostel, you already know, तुम्हारा दोस्त रात को बोलता है इसका वो कर देंगे, ये कर देंगे. So those things that you are having is your somna liquid. That is your sleep talking. Bruxism मतलब होता है teeth grinding. कुछ लोग रात में टीथ को ग्राइंड करते हैं एंड कुछ लोग रात में नॉक्टर्नल एन्यूरेसिस करते हैं. नो, दैट वुड बी सीन इन द चिल्ड्रन, राइट? जनरली सीन इन द चिल्ड्रन. सो नॉक्टर्नल एन्यूरेसिस मीन्स दोज पीपल हु आर डूइंग द बेड वेटिंग. बेड जो गीला कर देते हैं, दैट इज योर नॉक्टर्नल एन्यूरेसिस. इसके ऊपर क्वेश्चन आता है, व्हाट इज द ड्रग ऑफ चॉइस फॉर नॉक्टर्नल एन्यूरेसिस एंड व्हाट इज द ट्रीटमेंट ऑफ चॉइस? whatever guys, Dr. Puneet has some other reasons. Okay, so drug of choice will be desmopressin, guys. Basically, desmopressin will be working on which receptor? Desmopressin will be working on V2 receptor in your kidney, or V2 receptor are due to aquaporin. You will be having aquaporin. Aquaporin जो ADH काम करता है, एक्वापोरिन का फंक्शन क्या होता है, इट विल बी अब्जॉर्बिंग वाटर, राइट. सो व्हेन यू आर गिविंग डेस्मोप्रेसिन, व्हाट विल हैपन, ये एक्वापोरिन को एक्टिवेट कर देगा. व्हाट विल हैपन, वाटर विल बी रीअब्जॉर्ब्ड इन द बॉडी इटसेल्फ. रात को ब्लैडर नहीं भरेगा, ब्लैडर नहीं भरेगा तो पेशेंट विल नॉट यूरिनेट. ट्रीटमेंट ऑफ चॉइस विल बी बेड अलार्म्स और motivational behavioral therapy is also there. Okay, okay, so this is how it is working, right? So these are the two important things that you have to remember. Okay, very good. Now, which of the following is not considered as a negative symptoms? कौन सा negative symptom नहीं है? Anhedonia we have already seen. Okay, alogia, anhedonia, apathy. Which of the following is not a negative symptom? Negative पूछ रहा है. Negative symptom कौन सा नहीं है? Negative symptom is overactivity. Overactivity, this one is automatically odd one out. Okay, try to answer this one. Which of the following teratogenic effect can occur as a result of lithium usage during pregnancy? Pregnancy में lithium की वजह से क्या होगा? Try to answer. In pregnancy, what will happen due to lithium intake? Lithium intake की वजह से क्या होगा? Very good, AK Punit. Because of lithium intake, guys, there will be some kind of cardiac defect. These are known as Epstein's anomaly. Epstein's anomaly. Basically, they are teratogenic drug. They are teratogenic drug. That means they will be causing deformity in the baby. It will be causing some kind of deformity in the baby, and that is known as Epstein's anomaly. And when you look at the in pediatrics, when you look at the picture of the heart, you will be finding which kind of heart? Box shaped heart. You will be finding box shaped heart. Okay, that is box shaped heart. We will be discussing pediatrics. Okay, maybe day after tomorrow we will be having last session, that is pediatrics. Okay, next, which antidepressant would you recommend for a 42-year-old professor experiencing depression? Patient is having depression, he is a professor, he is having some depression, because professors are having depression, right? Yes or no? Okay, who is concerned with potential sexual dysfunction as a side effect. He wants कि ऐसी दवाई हो जिसका कोई side effect ना हो. What he wants? He wants ऐसी दवाई हो जिसका कोई side effect ना हो. Which of the following would you love to give this particular professor? Which of the following would you love to give this love to give to the professor? Is it bupropion? Bupropion we are also using for citalopram is a SSRI. It is a SSRI, guys. Venlafaxine is a SNRI. Fluoxetine is a again SSRI. Okay, this bupropion will be working via two methods. It will be causing depletion of those things which are blocking dopamine and norepinephrine receptor. Try to see here, dopamine and norepinephrine reuptake inhibitor. They are basically working on dopamine and norepinephrine reuptake inhibitor, and ultimately leads to a treatment of depression. Okay, SSRI and SNRI, why we cannot use SSRI and SNRI? They will be having, ultimately what they will be doing, look, both of them are having serotonin, like activity, and whenever serotonin will be increased, you know what happens? Whenever serotonin will increase, it will lead to some kind of sexual dysfunction. Maybe it is useful for some, maybe it is not useful for some, but it will be giving some kind of sexual dysfunction. That is why we are using what? We will be using what here? We will be using bupropion. That would be working on dopamine and norepinephrine receptor, not working on serotonin receptor. Okay, serotonin को नहीं छेड़ना है, इनको छेड़ना है, right? So what is the term used to describe the phenomena where a patient in the response to the question, how are you, by repeating the same sentence. Okay, so what is happening if I am asking you how are you, how are you, so what is happening, you are again asking me, sir, how are you? Okay, so patient is constantly repeating the same question, right? Patient is constantly repeating the same question. Now try to answer, what is that? Is it coprolalia? Is it ecoprexia, coproprexia, echolalia? What do we call it? Ecoprexia. These are confusing terms, right? Let me make it easy for you. Let me make it easy for you. First of all, the answer is, again we are going in the same boat, guys. Again we are going in the same boat, and the boat is about to about to go. Look here. Yes, there is someone who is changing the boat. That is Viman. Okay, Viman. Viman Sandhu. Viman is going via Viman. He don't want to go in the boat itself. Don't offend. Okay, let's come back to the topic, guys. So we are having coprolalia, we are having ecoprexia, we are having coproprexia, and we are also having echolalia. Just try to understand simple things we are having. Okay, repeating movements is echolalia? No. Look here, what is echolalia? Echolalia is repetition of words, repetition of phrases. Okay, so for example, I'm telling something, you will also tell I'm telling something, so that is echolalia. That means repetition of the repetition of the words, that is speaking, right? Praxia means what? Ecopraxia means repetition of behavior, guys. Repetition of behavior. For example, I am doing like this, so you will also do like this. That is ecopraxia. That is ecopraxia. Okay, that is praxia का मतलब क्या होता है? Simple understand. Praxia का मतलब होता है, the meaning of praxia will be movement. The meaning of praxia will be movement, and meaning of lalia will be speaking. Okay, the speaking. Okay, eco will be same thing will be there, right? So coprolalia means what? Copro मतलब क्या होता है? Abusive. Okay, so copro मतलब inappropriate sentences will be spoken by the patient. Sentence spoken. Okay, copropraxia means inappropriate texture, appropriate absence, you can also call it absence gestures. Okay, or inappropriate movements. That is basically copropraxia. Okay, copropraxia. Okay, basically remember, guys, these coprolalia or copropraxia, these are the symptoms that are generally associated with your Tourette syndrome. Tourette syndrome, you must have seen the movie. In the movie, kaun si movie thi? What is the movie you have seen? Tourette syndrome. Tourette syndrome is present in, there is a movie. So in that Tourette syndrome, you know what happens? These are the movements that you will be finding. Coprolalia, copropraxia, these are the movements you will be finding in these type of symptoms. Okay, so now try to answer this question. What is the fear of height is known as? Fear of height. Fear of height is known as what? First of all, maybe if you know, fear of height is एक्रोफोबिया. ये क्या होता है? अकारोफोबिया. अकारोफोबिया क्या होता है बच्चों? व्हाट इज एक्रोफोबिया? यस, दैट वाज द हिचकी मूवी. रानी मुखर्जी की मूवी थी, दैट इज हिचकी. There was a difficult question, and even NMC is not able to answer, right? Acrophobia. Acrophobia. Try to answer, what is acrophobia, guys? Acrophobia. I know you know the answer. What is acrophobia? Basically, it is, and I said question, it is fear of mites, small insects. Fear of mites, or you can say small insects. Okay. Algophobia. Algophobia का मतलब क्या होता है? Algo. Algo means, what is algophobia? Algophobia will be having what? Fear of agoraphobia, you already know, that is fear of places from where the escape is difficult, from where the escape is difficult, the escape is difficult. These are known as agoraphobia. Okay, acrophobia you already know, that is fear of heights, fear of open spaces. Yes, it can be a open ground, it can be a open ground, that is agoraphobia. What is algophobia, guys? Algophobia. एल्गोफोबिया नहीं पता? इट इज फियर ऑफ पेन. एल्गोफोबिया मतलब फियर ऑफ पेन विल बी देयर. Okay, we use analgesia, all those things. So algophobia, analgesia means painkiller, right? So algophobia will be fear of pain will be there, fear of pain will be there, fear of pain. Okay, next, all are stages of grief or loss except. So what are the stages of grief or loss? Agar something is lost, there is some kind of grief, what are the stages that you would be encountering? So what is the mnemonic that you remember? Try to write down a mnemonic. Try to answer this one. All are stages of grief or loss except. The mnemonic is dabda. So these are the stages that you will be finding. First, the patient will deny. So that is your denial. Second, the patient will show, the person will show anger. Okay, second stage will be anger. Third stage will be bargain. He will be bargaining. Okay, next stage will be depression. The patient will go into depression. Even after death of someone, these things will happen. First of all, he will denial, then he will anger, then he will go to God for bargaining. Okay, he will be going to depression, and ultimately A will be acceptance. Acceptance. Ultimately, the ultimatum will be acceptance. Okay, acceptance. So agitation will not be the answer. So that would be odd one out, that would be D. Okay, D will be the answer here. Okay, next one. Which drug among the provided options would assist a chronic smoker in their aim to quit the smoking? So those people who are smoking, how they will quit the smoking, upon among these drugs, which drug will be utilizable? D. So how bupropion, just remember one more thing is there, anti-anxiety drug, that is buspirone. Buspirone will be dealing with the rona, right? So it is a anti-anxiety drug. It is an anti-anxiety drug. This one will be dealing with the PO. PO means what? Cigarette PO, right? Sutta, right? So that is the buspirone or bupropion. Okay, so bupropion we will be using for anti-smoking, and also vernicillin we will be using for anti-smoking. Very good, guys. Ultimately, you know what they will be doing, we have already discussed what they will be doing. They will be dealing with the dopamine receptor, they will be dealing with the norepinephrine receptor, right? So they will be decreasing the craving, okay, and withdrawal. Both of them will be working like that. They will be dealing with the decreasing the craving, and they will be dealing with the withdrawal symptoms. जो withdrawal के symptoms आ रहे हैं उनको कम कर देंगे. Okay, one more question that has been asked from this vernicillin. It will be working on alpha 4 beta 2 receptor. Remember, guys, it will be working on alpha 4 beta 2 receptor. These are basically nicotinic. They will be working on nicotinic cholinergic receptor. Okay, they will be working on nicotinic cholinergic receptor. And you know what they will do, because of constant smoking, you know what happens, the patient will be smoking, what will happen, this receptor will get activated. It will be activating cholinergic system, because smoking will be having nicotine will be producing acetylcholine, and acetylcholine is concerned with cholinergic or your parasympathetic nervous system. उसी की वजह से जो भी parasympathetic की चीज़ें होती है, those things will be happening in your body, right? You will be having peristalsis, you will be having contractions of glands, all those things, right? We have discussed in pharma, right? So what will happen? Nicotinic cholinergic receptors will get activated and they will be causing release of dopamine again. Dopamine. And because of this dopamine, what will happen? You will be having constant repeated behavior. Because of this, your neurons will get strengthened and you will be having addiction due to smoking. You will be having addiction due to smoking. So what we are doing in vernicillin, we will be blocking these receptors particularly, right? We will be blocking these receptors, and because of that, what will happen? The patient will be able to quit smoking, right? Yes, we can use vernicillin. Okay, a patient stopped alcohol consumption from last 3 days. Now you have to answer. Patient is not having alcohol from last 3 days, okay, and presented with irritability, disorientation, paranoid delusions, agitations, visual hallucination, and altered sensorium. What is the most likely diagnosis over here? What is the most likely diagnosis over here? Is it Wernicke's? Is it Korsakoff? Is it alcohol-induced psychosis? Is it delirium tremens? Very good, guys. Very good. Now you are understanding that time period is already given. We have given the time period, that is 48 to 72 hours already completed. It is more than 72 hours. The story will be of delirium tremens. This story will be of delirium tremens. All these symptoms are delirium tremens. Okay, what is Wernicke's encephalopathy? It is an acute, remember guys, it is an acute neurological disorder. Neurological disorder. Why it is happening? And what are the symptoms you will be finding in Wernicke's? Remember, Wernicke's is a different entity and Korsakoff is a different entity. You know what happens whenever you are having Wernicke's encephalopathy? You will be having, in the question, you will be having symptoms like nystagmus. Okay, nystagmus. You will be having abnormal gait, basically known as ataxia. Ataxia will be present. The patient will be having confusion, and all these problems are due to what? All these problems are due to decrease in the level of B1. Vitamin B1 will be decreased, also known as thiamine. So what we need to do? We need to give the thiamine to the patient. Apart from that, when this acute neurological disorder is not getting treated, it will convert into this particular disease that is known as Korsakoff psychosis. Psychosis is a disease, right? This is your encephalopathy. What will happen if not treated? What will happen? This untreated, look here, untreated Wernicke's encephalopathy will lead to Korsakoff psychosis. Korsakoff psychosis. Okay, you will be having confusion, all those things, right? If I talk about alcohol induced psychosis, it can be due to intoxication, it can be due to withdrawal, it can be due to alcohol intoxication, and it can be due to withdrawal. But the thing that you have to remember is the time period. This is basically alcoholic hallucinosis. This is known as alcoholic hallucinosis. This is known as alcoholic hallucinosis. This is basically the same thing, right? This is the same thing that we have studied, right? So we will be having tremors, we will be having alcoholic hallucinosis, we will be having seizures, and we will be having delirium tremens. How you will put these patient we will be giving drug of choice, that is your benzodiazepine, that is chlordiazepoxide. Remember guys, in our OPD we do not have chlordiazepoxide. In our PHC CHC, so we can use benzodiazepines, other benzodiazepines also. Okay, we are using clonazepine, benzodiazepines also. Okay, clonazepam and lorazepam we can also use. Those people who are having liver disease, lorazepam will be safer option. Okay, so we can use lorazepam. Which of the following drug abuse can lead to the symptoms described by a 25-year-old male patient who complains of a sensation resembling insect crawling beneath his skin, and he is presented to the clinic? What is the thing that will happen here? Very good. Yes, you will be having global confusion, ophthalmoplegia, and ataxia. That these are the symptoms you will be finding, right? Very good, Sahana. So try to answer this one. B. These are the symptoms you will be finding. Very good. This is your cocaine. These are known as cocaine bug or formication. This is also known as formication. Okay, this is also known as formication or Magnan phenomena. Basically, this cocaine will be stimulating what? Cocaine will be working on what? Cocaine is a stimulant or it is a depressor? Cocaine क्या करता है? Cannabis. What is cannabis? Cannabis is your ganja, right? It is your marijuana, ganja, whatever is you call it. So basically, it is a CNS depressant. Cannabis is a CNS depressant. Cocaine is a CNS stimulant. Okay, it will be activating the CNS. Amphetamine is also a CNS stimulant. That is what we are using as a drug as well, right? And alcohol, we already know it is a CNS depressant. Those people who are smoking along with the alcohol, is it right? Smoking will do what? It will be having acetylcholine. It will be ultimately having nicotine will be going to nicotinic receptors, and it will be activating parasympathetic nervous system. That would be releasing what? Acetylcholine. So acetylcholine is activated by smoking, and GABA is activated by alcohol. So we should not consume it. We should not consume any of these. Okay, we should not consume any of this, but those who are having it, that is the wrong thing, right? So alcohol will do what? Decrease in the CNS. ये थोड़ा extra ज्ञान ले लो, right? This is your cocaine. Okay, next one. Next, we have already answered. Very good, Sahana, Puneet. So jet plaque pigmentation of the tongue with tactile hallucination is a feature of. It is a feature of what? It is a feature of again cocaine. Again cocaine. Remember, guys, cocaine will cause vasoconstriction. That is why patient will be having hypertension. Okay, patient will be having hypertension, and due to that vasoconstriction, those people who are sniffing the cocaine, what will happen? There will be nasal septal defect. Nasal septal perforation will be there. Okay, because of constant vasoconstriction, what will happen? The artery will not get supply, right? And it will be causing perforation. Okay, so your answer here will be cocaine. Answer here will be cocaine again. In which of the condition is la belle indifference is observed? In which of the following condition you will be finding this la belle indifference? La belle indifference का मतलब क्या होता है? First of all, let me tell you. There will be. Please try to answer. Let me see if you know. Let me see if you know. What is la belle indifference? So is it a panic disorder? Is it a schizophrenia? Is it a depression? But before that, you have to answer me. What is la belle indifference? What is that? So what are the different things you will be having here? La belle indifference. It is a conversion disorder. There will be absence of psychological distress. There will be absence of psychological distress in spite, look here, in spite of having serious disorders. So these are the patients who will be having absence of psychological distress. Okay, no, answer will be A. Answer will be A. D cannot be the answer. Okay, D cannot be the answer. In depression, you will not see this type of behavior. If someone is diagnosed with cancer, they will be like, okay, no problem. They will not show any kind of psychological distress. Okay, so this is a type of conversion disorder. Which mental functions are examined in this mental state examination test? What is the mental function that we can see over here? Judgment, language, orientation, concentration. Which is this test? 7 series subtraction test. Okay, we are subtracting 7 out of 100. That would be 93. Subsequently, we are checking. We are using this test. This test is used for Shoaib, very good. Puneet, Besla, Saurabh. So this test is used for concentration. Judgment I have already told you. Judgment, how you will check the judgment? Room के अंदर आग लगी. What you will do? You will jump out of the window, or you will try to like fight with the fire. Or for example, there is a tiger just behind you. What you will do? You will run, or you will fight with the tiger. So this type of question will be helpful for identification of judgment. Okay. For example, tiger versus you. So who will win? You already know who will win. So that is the tiger versus you. First thing. Second thing we are having is language. How you will check for the language? For language, you will be checking for name. You can ask about some kind of object. Okay. You can tell the patient to repeat some kind of phrases. Okay. And you can also tell the patient to write something. That would be writing test you can do. These are your higher mental functioning that we have studied in your MSc mental state examination. Okay, we can check for orientation. How we will check? We will ask the patient the time, the place, or we can ask about the space. Okay, space to the patient. So the patient can tell us about the name of the patient, the date of the, like what is the date today. The patient can tell us about the location, where are you right now. So this is how you will be checking for the orientation. Okay, this is how you will be checking for the orientation. What non-pharmacological measures can be recommended in a middle-aged men who experience premature ejaculation? Try to answer. फायदा दोनों में ही नहीं, टाइगर से फाइट भी नहीं होगी और भागने से का तो कोई सवाल ही नहीं उठता. Try to think about it. You will get another option. There are limitless possibilities. Every time when you are about to give up, remember guys, there are limitless possibilities. Okay, so giving up is not an option. Never. Exam is very near, and some people might be thinking कि इस बार नहीं अगली बार कर लेंगे. Just give your 100% at this point of time. अभी एग्जाम है, जस्ट गिव योर 100%. बाकी जो होगा भगवान देखेगा, ऊपर वाला देखेगा. वॉट एवर देर इज अ सुप्रीम पावर, they will be looking at it, right? So you need not to worry about your results. You need to just worry about your work. Just the important thing is whether you are giving your 100% or not. That is the most important thing, guys. Okay, so try to answer this one. So we are talking about premature ejaculation. Premature ejaculation, we have already seen. What is the pharmacological treatment that I can give to this particular patient? And when I'm using cognitive behavioral therapy, remember guys, we are using cognitive behavioral therapy in anxiety and in depression. Anxiety or depression के cases में we have used exposure and response prevention therapy. We have seen in the cases of OCD. We have seen in the cases of OCD. Okay, squeeze technique. Squeeze technique is the technique we can use for this particular patient. Apart from that, what is sensate focus therapy? That is why tension मत लो. Okay, what is sensate focus therapy? टेंशन लेने से your result is not going to change. In after pediatrics class, I would be telling you how to go to examination, what are the different things that you need to see. Okay, कैसे पेपर देना है, that is very very important. Okay, just attend that session also. Okay, so in the end I would be discussing how to give the exam. Okay, sensate focus therapy. So basically it is a form of sex therapy. It is a form of sex therapy. This option they have given in your INI set examination. Basically they are the same board, they are taking the examination, they are having the common Q bank, so you can get questions from this. So sensate focus therapy will be a type of sex therapy. Basically in this we will be telling the patient, just a moment, we will be telling the patient different kind of exercises to increase the sexual communication. Different type of exercises are taught to the couple to increase the sexual communication. And this is generally done because there are some people who are having psychogenic cause. Okay, they are having some performance anxiety. So this one is done to decrease the performance anxiety. This is to done the decrease the performance anxiety. Okay, performance anxiety. Day after tomorrow, on 4th, we will be having that session. What is the term used to describe the therapist feeling towards the patient? which can be both conscious or unconscious and can be both negative and positive. So they just want to know what are the feelings of a therapist towards the patient are known as. जो थेरेपिस्ट की जो भी फीलिंग होगी टुवर्ड्स द पेशेंट दे आर नोन एज व्हाट? ट्रांसफरेंस, काउंटर ट्रांसफरेंस, एम्पैथी, प्रोजेक्शन. व्हाट इज दिस? We are almost done. Next 10 minutes max we are done. Okay, so transference means what? This is transference is basically feeling of patient. This is basically the feelings of patients towards the doctor. Okay, counter transference is what? Feeling of, these are the feelings of a therapist. Feelings of therapist. These are the feelings of therapist. We call it, that would be C. During intercourse, we can use one technique, that is squeeze technique. Squeeze technique is basically we are squeezing the penis, and because of that, what is happening? It will prevent the ejaculation. That means just before the ejaculation, what we can do? We can press the penis. So what will happen? Your muscles. What are the muscles that will be incorporated? They will be stopped, right? So what will happen? You will be having no premature ejaculation. That is how you can do. Okay, next one. So what is the answer for this? So transference is feeling of a patient. Counter transference is feeling of a therapist towards the patient. Okay, so our answer will be answer will be what here? What is empathy? Till then, let me teach you what is empathy. Basically, empathy is ability of a doctor or a therapist. It is the ability of a doctor or a therapist to understand and share the feelings of the patient. Empathy का मतलब तो पता ही हो, right? So basic same empathy will be there. What is projection, guys? What is projection? What is projection? It is a type of defense mechanism. इसका लेना देना नहीं है थेरेपिस्ट और पेशेंट से. It is a type of defense mechanism. For example, कोई भी चीज, anything you are projecting to the person B. Okay, for example, you are having some thoughts, you are having some feelings, all these things that you are projecting to another person. Okay, these are the defense mechanism. Defense mechanism हमारे पास में, we are having defense mechanism, so that is what one of them is projection. Okay, projection. What happens? पापा ने तुम्हें मारा, तुमने छोटे भाई को मार दिया, तो कहानी खत्म, right? Whatever emotions you are having will be suppressed, right? So this is how it is happening, right? Which of the following fact about the structural theory of mind is incorrect? Ionized, FMGE, NEET PG, all PYQs are incorporated. If you see this, I think you will be able to solve most of the questions. Now you will be understanding. We have solved approximately 70 to 80 questions, I guess. So after this, you will be in the state, you will be identifying how to solve the questions. Okay, that is why it is useful, guys. Which of the following fact about the structural theory of mind is correct? I've tried to cover up most of the topics. I've tried to cover most of the topics. I think these are the two last questions that we are having. Try to solve this one. Which of the following fact about the structural theory of mind is incorrect? So we are having in subconscious mind, we are having three things. We are having id, we are having ego, we are having superego, right? We are having id, we are having ego, we are having superego. इड वाला बोल रहा है क्या ही करना है क्लास देख के, ओके बाद में पढ़ लेंगे कभी. सो दैट इज योर इड माइंड दैट इज टेलिंग यू. सुपर ईगो इज टेलिंग यू, चल सुपर ईगो इज टेलिंग यू यू हैव टू फोकस इन द क्लास, दैट इज कंसर्न विद यू. ओके, वो सारा ये बताएगा यू हैव टू फोकस इन द क्लास, यू हैव टू स्टडी, नहीं तो फेल हो जाएगा, दिक्कत हो जाएगी, राइट? एंड यू आर वर्किंग समवेयर इन बिटवीन द ईगो. यू आर वर्किंग समवेयर इन बिटवीन द ईगो कि यार 10-15 मिनट में क्लास खत्म हो जाएगी, देन आई विल गो हैव माई डिनर and I'll go out and do whatever you want to do, right? So these are the three unconscious mind that are working, right? They are working. एक id होता है, एक ego होता है, एक super ego होता है. Id will be working on which kind of principles? It will be working on pleasure principles. Okay, pleasure principles. It will be working on pleasure principles. जिन कामों में तुम्हें मजा आता है. That is what is concerned with the id. जैसे पढ़ाई में किसी को मजा नहीं आता. क्यों नहीं आता पढ़ाई में मजा? क्योंकि we are not made for study, right? We are not made for study. Nobody is designed for studying, right? So that is the pleasure principle it will be working on. That is your id mind. Okay, ego is the executive organ of the mind and balances the demand of id and superego. Yes, this is a true statement, right? So this is a true statement. This one is also a true statement. Okay, superego develops between 5 to 6 years of age and is mostly present in the conscious part. No, we are discussing about the subconscious. We are discussing about the subconscious mind. It is not related with the conscious one. Okay, the structural theory of mind consists of id, ego and superego representing different aspect of the mind. So this is also a true statement. Here the answer will be C. Here the answer will be C, bachcho. Okay, superego, ego and id, all of them are your subconscious mind. Okay, subconscious mind mein whatever, why you are having dreams, why you are having dreams, we are having dreams because you know what happens, तुम्हें तुम्हारे पापा ने पीटा, right? Your father has beaten you for some work. Now you cannot तुम उस चीज़ को किसी के ऊपर डाल नहीं सकते, right? You cannot beat your father again, right? So what you will do, you will be having dreams. Those emotions will be going to your subconscious mind. वो emotions subconscious mind में जाएंगे and what will happen, they will be coming in the form of a dream. In dream what will happen, what are dreams? Basically dreams में क्या होगा, what will happen, you will be throwing stones on a dog, right? You will be running behind a dog. So basically your body has done, your mind has done what, it has represented your father as a dog, right? In your brain तुम उस कुत्ते को मारोगे and your emotions will be suppressed. Like this we are having dreams. So next time when you are having a dream, try to decode it. You will be getting what is the thing that is happening in your बॉडी. वो सुबह वाला ड्रीम जो पूरा नहीं हो पा रहा है, क्यों नहीं हो पा रहा है, देयर मस्ट बी सम रीजन, राइट? एंड यू आर गुड फॉर डिकोडिंग. ओके, सो यू कैन डिकोड दैट. नेक्स्ट वन इज योर this image. Okay, yes, mind is wild monkey. We are all wild monkeys, and monkeys or basically whatever we are, any organism, they just want to reproduce, right? So reproduction is the ultimate, growing of the species is the ultimate target, right? And because of that we are lots of humans already, right? Which of the following statement about the given image shown below is incorrect? First of all, try to identify. In psychiatry we will be having most likely two or three questions total जो image based होंगे. Out of them one is this. The image is one of the cards used in Rorschach test. Is it a true statement or a false statement? So basically what is this testing is done for? कहाँ करते हैं ये test? Those people who are having some kind of psychiatric disorders. Okay, so when the patient will be going to psychiatric department, the patient will be having assessment. Okay, patient का जब assessment होता है, then we are giving this kind of images to the patient, and then we will ask the patient what you are seeing. Some people will find butterflies, some will find aliens, some will find dinosaurs. Okay, so these are the basically ink blot images, and this test is known as Rorschach test, just to identify their brain situation, what is happening in their brain, how they are perceiving things. We are doing this test. Okay, and they want to know which of the following is incorrect. The image is one of the card used in the Rorschach test. Yes, this is a true statement. Okay, the description in the image is objective. Is it an objective thing? You guys are having exam, objective and subjective. Subjective exam, the person will be writing according to their mind, right? In objective, he needs just to mark the option, right? So it is not an objective test, guys. It is a subjective test. The patient will be having a lot of possibilities. The patient can say anything after just looking at this. Okay, so this one will become the false statement. Apart from that, the images are typically symmetrical and ambiguous. Yes, it is a true statement. The test involves asking individuals to interpret what they see in the image. This is also a true statement. So answer here will be B. And I think we are done with this. Yes, we are done with this. Thank you so much, guys, for all your patience. Just remember, nobody can go back and start a new beginning, but anyone can start today and make a new ending. Okay, these are my Instagram and Telegram channels. In case if you want to connect with me for further updates about classes, questions, whatever you want to ask, you can connect with me. Okay, so we will be meeting day after tomorrow for pediatric session, same channel. Tomorrow we will be having class on for micro and derma. In case if you want to connect, you can join me on Instagram or Telegram. You can ask me there. Okay. All right, we are done with the psychiatry. Now go and solve some questions from psychiatry. I think most of the questions you will be able to solve, right? And we are done in just about 3 hours, right? Thank you so much, guys. Thank you so much. We will be meeting.